Muy buenos días a todos.
Good morning, everybody.
Vamos a empezar para
We will now
continuar con la agenda.
continue with our agenda.
Espero que hayan podido descansar
I
y
hope that
recargar
you've been
energías para
able
este
to
nuevo día de
rest
trabajo.
and,
Y solamente empezar con una nota,
recover energy for
que
the
la
day's
salud
work.
necesita enfoque, colaboración y resultados concretos. Y para lograrlo, cada espacio de esta asamblea,
Is
la
on
plenaria, los
work and
comités,
outcomes here. So each space in the
mantener el foco verdaderamente
We want to
en lo
keep the
importante,
focus
las personas que representamos.
very
Tenemos que
much
recordar que cada minuto que nosotros pasamos
on
aquí
our work. Each minute
debe
we
valer
spend here
fuera. Con
has
esa
to
nota,
bring value to the
quiero
outside world.
empezar
And recalling that,
el día de hoy.
I'd like to begin today's work.
Okay, excellent. Esta mañana
This morning,
se abre la sesión. Esta mañana reanudaremos la sesión plenaria con el punto 2 del orden del día, el informe del Consejo Ejecutivo sobre sus 157 ABA y 158 ABA reuniones, seguido del punto 3 del orden del día, que es la locución del director general. Pasemos ahora al punto 2 del orden del día, informe del Consejo Ejecutivo sobre sus 157 y 158 ABA reuniones, y tengo el placer de invitar a subir a la tribuna al presidente del Consejo Ejecutivo, el señor Blair Cumley. Señor Cumley, tiene la palabra.
You have the floor. Is he here?
Mr. President, Dr. Tedros, Director General of the World Health Organization, Honourable Ministers, Excellencies, distinguished delegates, ladies and gentlemen. Let me start by offering my heartfelt congratulations to you, Mr. President, and the other office bearers on your election, and by expressing my best wishes for productive and successful stewardship of the Assembly. As the Chair of EB, my advice is in Derek we trust when it gets difficult. I am pleased to provide this statement on behalf of the members of the Executive Board, who I am grateful to for their active engagement and support in the last year. My statement summarises the main outcomes of the 157th and 158th sessions of the Executive Board and will focus on key resolutions and decisions. For further details, kindly refer to the full report contained in document A79/2. At the 157th session held on 28 to 29 May 2025, the Board considered 18 items and sub-items and adopted 3 resolutions and 11 decisions. Notably, the Board appointed Dr. Mohamed Junabi as the Regional Director for Africa, approved the revised WHO Evaluation Policy 2005, adopted the process for the nomination and appointment of regional directors, and appointed members to fill the vacant position on its committees and selection panels. Regarding governance reform, the Board recognised the urgency of easing organisational pressures on WHO. The officers of the Board moved beyond noting reports to actively accelerate member state-led reforms, which we carried forward in the intersessional period prior to EB 158. We convened multiple times, and I want to thank the officers for their commitment and dedication. The officers of the Board's engagement was essential in ensuring efficient and effective leadership. Moving on to the main outcomes from the 158th session of this Board, which was held from 2nd to the 7th of February 2026, the Board considered 51 items and sub-items and adopted 8 resolutions and 25 decisions. In relation to the matters under Provide Health, the Board noted reports on follow-up to the political declaration of the high-level meeting of the General Assembly on the prevention and control of non-communicable diseases, mental health, communicable diseases, universal health coverage, primary health care, health in the 2023 Agenda for Sustainable Development, and substandard and falsified medical products. We recommended that the Health Assembly adopt the following decisions: welcoming the political declaration of the 4th high-level meeting and requesting support for its implementation, requesting the development of a post-2030 tuberculosis strategy, adopting the Global Strategy for Integrated Emergency, Critical and Operative Care 2026 to 2035, and deferring consideration of the proposed Global Strategy on Donation and Transplantation to the 80th Health Assembly. We also recommended that the Health Assembly adopt resolutions on global action to advance health equity for people with haemophilia and other bleeding disorders, steatotic liver disease, a missing piece in the global non-communicable disease response, precision medicine, a path towards targeted, personalised and equitable care, strengthening equitable access to diagnostic imaging through teleradiology, reducing the burden of stroke, strengthening prevention, acute care, rehabilitation and health system readiness, and advancing smart, efficient pharmacovigilance as an essential tool for robust, sustainable, resilient and responsive health systems for everyone, everywhere. Having noted the report of the Expert Advisory Group on the WHO Global Code of Practice on the international recruitment of health personnel, the Board adopted a decision requesting the Director-General to facilitate Member State-led informal consultations on a decision or resolution focused on the Expert Advisory Group's recommendations to be considered for adoption by this Health Assembly. Regarding the draft updated Global Action Plan on antimicrobial resistance, the Board decided that informal intersessional consultations would continue to be facilitated by the Secretariat in an inclusive and transparent manner, with a view to enabling the adoption of the action plan at this Health Assembly. In relation to matters under Protect Health, the Board noted the various reports and requested the Secretariat to organise a Member State briefing on the implementation of Resolution WHA 75.11/2022. The Board also noted the report on health conditions in the occupied Palestinian territory, including East Jerusalem, and following 2 recorded votes, adopted a draft resolution. Concerning matters under Promote Health, the Board noted the relevant reports and recommended the Health Assembly adopts a decision to deferred consideration of the draft Global Plan of Action for the Health of Indigenous Peoples to the 80th World Health Assembly in order to allow additional time for further consultations. The draft strategy on economics of health for all and a resolution on radiation and health, strengthening global protection, preparedness and response. With respect to matters under Power and Performance, the Board welcomed the report of the Program Budget and Administration Committee and noted the various reports, including on the financing and implementation of the Program Budget 2024-2025, an outlook on the Program Budget 2026 to 2027. The Board approved the organisation-wide evaluation work plan for 2026 to 2027 and adopted a decision on non-state actors in official relations. The Board also adopted a decision to streamline the Foundation Committees and selection panels. The Board recommended that the Health Assembly adopts the proposed amendments to the process for the selection of the external auditor and a resolution presented by a Board member on acknowledging the notification of withdrawal of the Argentine Republic from the World Health Organization. Regarding the reform of the global health architecture and the UN 80 initiative, the Board adopted an amended decision in which it requested the Director-General to design a proposal on a joint process hosted by WHO, which is led by Member States for consideration by the Health Assembly. Finally, regarding Member State-led governance reform, the Board took concrete steps to move from commitment to implementation. We adopted a decision on piloting agreed reform measures led by the officers of the Executive Board, as well as a decision on a sustainable model for Member State-led governance reform. This work reflects a shared commitment by Member States to sustain WHO as a trusted, effective and efficient global health institution. These proposed reforms are essential to enabling meaningful Member State engagement by all Member States and improving how we govern ourselves, make better choices and live within our means. A stronger, more transparent and effective WHO is essential to ease pressure on the global health system. Mr. President, distinguished colleagues, let me conclude by conveying my highest regards to you all and indicate my readiness to respond to any questions or clarifications you may need. Thank you.
Muchas gracias, señor Comley,
Thank you very
por
much,
el excelente
Mr.
informe.
Comley, for that excellent
Aprovecho esta
report.
oportunidad para
Allow me
rendir
to take this
homenaje
opportunity
a la
to
labor del
pay
Consejo
tribute to the
Ejecutivo
work
y
of
en
the
particular
Executive Board,
para expresar nuestro
and in
reconocimiento
particular
y nuestro
to
más sincero
express
agradecimiento a los miembros
our
salientes
gratitude
que
and
han contribuido
recognition
muy
to
activamente
outgoing
a
members
la labor
who
del
have
Consejo.
contributed
Con esto
actively
concluye
to
nuestro
the
examen
work
del
of the
punto
board.
2
That
de
concludes
la
our
orden del día.
consideration of item 2
Y
of
ahora
our
vamos a pasar
agenda,
al punto 3
and we now
de la
move
orden del
to
día, que es la
item
locución
3,
del doctor Tedros
which is the
Ghebreyesus,
address
director
by
general.
Dr. Tedros
Invito al doctor
Ghebreyesus,
director
Director
general
General,
a subir a la
and I
tribuna.
would
Doctor
invite
Tedros
him
tiene la palabra.
to take the floor.
Maybe we have to raise this a bit. Anyone who can help? Like, just a bit. Okay. You moved it. So this way. No. President of the 79th World Health Assembly, Dr. Victor Atala Lajam, Excellencies, Honorable Ministers and Heads of Delegation, dear colleagues and friends. Early on Sunday, I declared a public health emergency of international concern over an epidemic of Ebola disease in the Democratic Republic of the Congo and Uganda. This is the first time a Director General has declared a FIC before convening an emergency committee. I did not do this lightly. I did it in accordance with Article 12 of the International Health Regulations after consulting the ministers of health of both countries and because I'm deeply concerned about the scale and speed of the epidemic. We will convene the emergency committee today to advise us on temporary recommendations. So far, 30 cases have been confirmed in the DRC from the northern province of Ituri. Uganda has also informed WHO of 2 confirmed cases in the capital of Kampala, including 1 death among 2 individuals who traveled from DRC. And there is 1 US citizen confirmed positive and transferred to Germany, as reported by the US. And we're working with the DRC, Uganda, and also the United States. First, beyond the confirmed cases, there are more than 500 suspected cases and 130 suspected deaths. These numbers will change as field operations are scaling up, including strengthening surveillance, contact tracing, and laboratory testing. Second, cases have been reported in urban areas, including Kampala and the city of Goma in the DRC. Third, deaths have been reported among health workers, indicating healthcare-associated transmission. Fourth, there is significant population movement in the area. The province of Ituri is highly insecure, as you may know. Conflict has intensified since late 2025, and the fighting has escalated significantly over the past 2 months, resulting in civilian deaths. Over 100,000 people have been newly displaced. And in Ebola outbreaks, you know what displacement means. The area is also a mining zone with high levels of population movement that increase the risk of further spread. And fifth, this epidemic is caused by Bundibujo virus, a species of Ebola virus for which there are no vaccines or therapeutics. In the absence of a vaccine, there are many other measures countries, of course, can take to stop the spread of this virus and save lives, even without medical countermeasures, including risk communication and community engagement. I thank the government of Uganda for postponing the annual Martyrs' Day celebrations, which can attract up to 2 million people because of the risk posed by the epidemic. WHO has a team on the ground supporting national authorities to respond. We have deployed people, supplies, equipment, and funds. I have approved an additional $3.4 million from the Contingency Fund for Emergencies, bringing the total to $3.9 million. And I would like to use this opportunity to thank all countries who contribute to the CFE, and we will continue to keep all member states informed. As you know, WHO is also responding to the outbreak of hantavirus among passengers and crew on the MV Hondius cruise ship. The passengers have all been repatriated and will be monitored until the quarantine periods end on the 21st of June. Yesterday, the Hondius arrived in Rotterdam, where the crew disembarked and will be quarantined until the 29th of June. For the past 2 weeks, I have been in regular contact with the captain of the ship, Captain Jan Dobrowski of Poland, and I would like to thank him for everything he has done for the passengers and crew under his care. I'm sure Poland is proud of Jan. WHO's assessment continues to be that the risk of hantavirus globally is low. So far, there are 11 reported cases, including 3 deaths, and no deaths have been reported since the 2nd of May, when WHO was first informed of the outbreak of the ship. Those numbers have changed little since the outbreak was first reported to WHO 2 weeks ago. As things stand, there is no sign that we're seeing the start of a larger outbreak. But of course, that could change, and we urge all affected countries to continue monitoring the passengers and crew carefully. I thank the many countries involved in the response. Spain not only met its legal duty under the international health regulations, but also its moral duty to the passengers and crew. I would especially like to thank Prime Minister Pedro Sanchez for his leadership and for his inspiring message at this assembly yesterday. Spain handled the situation with compassion and kindness to the passengers and the crew, and not just the legal obligation. I also thank South Africa, which was the first to confirm hantavirus at the National Institute for Communicable Diseases in Johannesburg. after the first patient was evacuated there. And I thank the UK for notifying WHO and all countries through the IHR. And I thank Cabo Verde for helping with the evacuation of the 3 symptomatic patients. I thank the Netherlands, which has been actively involved through every stage of the outbreak and has received the evacuees from the ship. And I thank Argentina and Chile for sharing their expertise and support in the epidemiological investigations and for donating reference material for PCR and serologic testing to 5 reference labs involved in the response. The outbreaks of Ebola and hantavirus in the past 2 weeks show why international threats need an international response. They show why the world needs the international health regulations and why it needs WHO. Despite the challenges we faced last year, of course, there were many achievements to celebrate. The WHO results report contains a comprehensive and interactive account of those achievements, with scorecards and country stories that demonstrate our impact on the ground. I urge you to use it. In one speech, I cannot do justice to the length and breadth and depth of WHO's work or my colleagues' work. But allow me to highlight a few key achievements according to each of the 3 key priorities of the 14th General Programme of Work to promote, provide, and protect health. Let me begin with our work to promote health and prevent disease by addressing its root causes. This year, as you know, marks the 40th anniversary of the Ottawa Charter, a landmark declaration that reminds us that health is created in the places where people live, learn, work, and play. I would like to pay tribute to the architect of the Ottawa Charter, Professor Ilona Kickbush, and the then Director General, the late Dr. Hafden Mahler. In the past year, WHO has worked to promote health and prevent disease in 6 key areas. First, tobacco. Last year, the WHO Framework Convention on Tobacco Control celebrated its 20th anniversary. Since the FCTC entered into force, tobacco use has dropped by 1/3 globally and continues to decline in 140 countries. With support from WHO, Maldives became the first country to adopt a generational tobacco ban for people born from 2007. And this year, the United Kingdom followed suit, banning the sale of tobacco to anyone born from 2009 onwards. Just last week, Zambia's parliament approved a landmark comprehensive tobacco control bill after years of work and strong support from WHO. Despite progress against traditional tobacco products, we face a rapidly changing market of new and emerging nicotine products, including e-cigarettes and nicotine pouches. Last week, WHO published a new global report exposing the marketing tactics and strategies driving the global growth of nicotine pouches. Second, health taxes. Last year, WHO launched the 3x35 initiative, calling on all countries to raise the real prices of tobacco, alcohol, and sugary drinks by at least 50% by 2035. In the past 12 months, India, Jamaica, Malaysia, Mauritius, Mexico, Montenegro, Vietnam, Saudi Arabia, Sierra Leone, and Zambia were among countries that either announced, introduced, or increased taxes on one or more of these products. Third, nutrition. At this assembly last year, Member States approved the extension of the 6 WHO Global Nutrition Targets to 2030. Two of the targets were almost met on exclusive breastfeeding and childhood overweight, so member states increased them. Almost 50% of children worldwide are now breastfed at least for 6 months. And 146 member states now have legal measures in place to protect breastfeeding, covering 91% of all births globally. Although obesity continues to rise in many low and middle-income countries, recent analysis show that obesity rates are plateauing in some high-income countries. Also last year, WHO verified Portugal and the United Arab Emirates for the elimination of trans fat, a leading driver of cardiovascular disease. We will recognize both countries for their achievements later today. Fourth, climate and environment. In the past 12 months, the WHO Alliance for Transformative Action on Climate and Health grew to more than 100 countries, supporting them to build climate-resilient, low-carbon health systems. Member states also endorsed an updated global roadmap on air pollution and health, including a commitment to halve health impacts by 2040. And new data from WHO, UNICEF, Joint Monitoring Program showed that 1 billion more people now have access to safely managed drinking water than a decade ago, saving millions of lives. Fifth, violence, injuries, and drowning. In the past year, 68 countries have reported progress on violence against children, based on the pledges they made at the first Global Ministerial Conference in Colombia in 2024. For example, Benin is rolling out a national plan of action on child marriage, while Mongolia is introducing a nationwide child protection workforce. With partners, we launched the first global strategy for drowning prevention with a target to reduce drowning deaths by 35% by 2030. WHO also supported 15 more countries to strengthen legislation and action on road safety. For example, Ghana adopted new safety standards for child restraints in vehicles and motorcycle helmets. We urge countries to agree a strong political declaration at the UN high-level meeting on road safety to be held in July. And 6, cities. Over the past 12 months, almost 140 cities joined the regional healthy cities networks in 24 different countries, including 69 cities in Saudi Arabia alone. And WHO's Urban Health Capacities Assessment and Response Resource Kit was implemented in 14 cities, collectively home to approximately 33 million inhabitants. Participating cities have improved food safety, housing affordability and quality, and indoor air quality. Now to our work supporting countries to provide help by strengthening health systems and primary health care on the road to universal health coverage. Here are 4 areas we're doing that. First, health financing. Following deep cuts to official development assistance last year, WHO developed guidance on responding to the health financing emergency, supporting countries including Cambodia, Ethiopia, Mozambique, and Uganda. We're also supporting Sierra Leone under the leadership of the Vice President to navigate the impact of the cuts while also launching an ambitious health system reform. And with the World Bank and the government of Japan, we established the UHC Knowledge Hub in Tokyo, which is now supporting the first 8 countries with capacity building, knowledge sharing, and by bringing ministries of health and finance together, especially to increase fiscal space. Second, health workforce. The world is facing a shortage of 11 million health workers by 2030, with the biggest gaps in the African and Eastern Mediterranean regions. More than half the gap is the shortage of nurses, as last year's landmark State of the World's Nursing Report showed. In the past 12 months, WHO supported 11 countries facing the most acute shortage to strengthen their national workforce strategies, contributing to commitments for nearly 100,000 new health worker jobs. With WHO support, 38 countries have more than doubled their health workforce over the past 10 years. This Assembly will consider the important additions to the WHO Global Code of Practice on international recruitment of health personnel. Building the capacity of the global health workforce was one of the main reasons for establishing the WHO Academy in Lyon, with the support of the government of France. Following the restructuring, the Academy brings together WHO's work on health workforce strengthening alongside its learning function. The Academy now offers more than 400 courses free of charge in 23 languages, with more than 120,000 enrollments so far. I urge all member states to make use of this resource, and it's because it's there for you. One of the courses offered by the Academy is the Basic Emergency Care Program, which has now been implemented in over 100 countries. 4 African countries are now bringing it to scale in 846 health centers and hospitals over the next 2 years, saving tens of thousands of lives. Third, health products. In the past 12 months, WHO pre-qualified 50 medicines, 6 vaccines, 15 in vitro diagnostics, 41 medical devices, 6 vector control products, and performed 198 inspections of manufacturing sites. We also updated the essential medicines list to include new medicines for cancer and GLP-1s for diabetes in people with obesity. To expedite pre-qualification and procurement, we designated regulatory agencies in 5 more countries as WHO-listed authorities: Australia, Canada, Indonesia, Japan, and the United Kingdom. In addition, we recognized Ethiopia and Kazakhstan for reaching maturity level 3 for regulatory oversight of medicines and vaccines, and Singapore for reaching maturity level 4 for medical devices. And just 3 weeks ago, we designated regional training centers for biomanufacturing in countries in each region: in Brazil, China, Egypt, India, Ireland, Senegal, and South Africa. This is a major step forward in strengthening the global workforce needed to support local manufacturing based on the COVID lessons, as you remember. On AMR, the Global Antimicrobial Resistance and Use Surveillance System, GLASS, showed that 1 in 6 bacterial infections globally are now resistant to antibiotics, and the trend is increasing. To enhance the pipeline of new antibiotics, in March we published 3 new target product profiles for treating some of the most severe drug-resistant infections in at-risk populations worldwide. We also launched the Traditional Medicine Global Library with almost 2 million scientific records. Fourth, health data systems and digital technologies. Of the estimated 61 million deaths that occurred globally in 2023, fewer than 1 in 5 were reported to WHO with sufficient cause of death information for reliable public health analysis. Strengthening health data systems is vital to enable countries to generate and use their own data to guide public health action. In the past 12 months, WHO expanded the global digital health certification network to 82 countries, enabling 2 billion people to access their health records on national digital health wallets. And I would like to thank EU for the great support to this new department we have in digital health. And we have now rolled out ICD-11 to 132 member states, and every day our ICD systems receive around 4 million requests for information. Health threats in 5 areas. First, maternal and child mortality. Last year, WHO released updated estimates that more than 55 high-burden countries are using to prioritize and refocus. With partners, we issued the first consolidated guideline on postpartum hemorrhage, creating a single global clinical standard for the leading cause of maternal death that's saving lives when show little progress in 20 years. We supported policy change in 50 countries to reduce unintended little progress in 20 years. We supported policy change in 50 countries to reduce unintended pregnancy, expand STI and HIV self-testing, and accelerate screening coverage for cervical cancer. This year, with partners, we published new global estimates on newborn, child, and adolescent mortality, showing that in 2024, 4.9 million children died before their 5th birthday. Of course, there is a significant progress compared to 30 years ago when it was more than 11 million deaths a year, but still 4.9 million is big, and we have to continue to strengthen our efforts. Although under 5 deaths have fallen by more than half since 2000, progress has slowed dramatically. Reinvigorating it must be a global health priority. Second, vaccine-preventable disease. In March, we concluded the Big Catch-Up Initiative, an historic effort with Gavi and UNICEF to reach children who missed out on one or all routine vaccines, partly due to the disruptions caused by the COVID-19 pandemic. Over the past 3 years, together we delivered more than 100 million vaccine doses to an estimated 18.3 million children in 36 countries. We also supported 7 new countries to introduce malaria vaccines, bringing the total to 25 and targeting 10 million children every year. And we supported 15 more countries to introduce HPV vaccination to prevent cervical cancer. Since we launched the global call to action to eliminate cervical cancer in 2018, almost 75 countries have introduced HPV vaccination, meaning 65% of girls globally now live in a country with routine HPV vaccination. And of course, we need to do more. Despite funding cuts, the Global Measles and Rubella Lab Network processed more than 700,000 tests to detect and respond to measles outbreaks globally. And we conducted an analysis of 31 studies in multiple countries over 15 years that showed once again that vaccines, including those containing thiomersal and aluminum adjuvants, do not cause autism. Third, sorry, it's a long speech. Third, disease elimination. In the past 12 months, WHO has confirmed the elimination of 7 different diseases in 17 countries. And I'm proud to list all of them: Algeria, Australia, Burundi, Egypt, Fiji, Libya, Senegal, and Tunisia have all eliminated trachoma, Kenya eliminated sleeping sickness, and Chile eliminated leprosy. In addition, Bahamas, Brazil, Denmark, Maldives, and Turks and Caicos all eliminated mother-to-child transmission of HIV. And Botswana reached gold tier status on the path to elimination. Some of these countries also eliminated mother-to-child transmission of hepatitis B or syphilis, or in the case of Maldives, all three, the first country to achieve triple elimination. So congratulations to Maldives. In addition, 5 countries have been validated for maintaining elimination status: Cuba, Oman, Anguilla, Montserrat, and Sri Lanka. And WHO certified Suriname and Timor-Leste as malaria-free. So congratulations to all 15 countries. The Special Program for Research and Training in Tropical Diseases, TDR, contributed to Suriname's achievement through research that helped to reach hard-to-reach populations. We will recognize all these countries today. And I also like to recognize the leadership of Mr. Yohai Sasakawa, who is celebrating 25 years as a WHO Goodwill Ambassador for leprosy elimination, our longest-serving Goodwill Ambassador, and still running strong. Arigato gozaimasu, Mr. Sasakawa. Thank you. Fourth, communicable diseases. On HIV, we took an important step forward by pre-qualifying lenacapavir in tandem with guidelines on its use, supporting the first 14 countries to roll it out. Lenacapavir is one of the most powerful and promising tools in the history of HIV. A long-acting injectable given every 6 months, it's next best thing to an HIV vaccine. On tuberculosis, WHO supported countries to expand access to rapid TB diagnostics, including new tests that can be used near the point of care. We also accelerated the rollout of shorter, safer, and more effective treatment regimens. And the TB Vaccine Accelerator is working with countries to prepare for the rapid integration of new TB vaccines into health systems should they succeed in phase 3 trials. On malaria, WHO pre-qualified the first treatment developed specifically for newborns and infants, as well as 3 new rapid diagnostic tests that can detect strains of malaria that other tests miss. On hepatitis, the Global Hepatitis Report published just last month shows that since 2015, the annual number of new hepatitis B infections has dropped by 32%, and hepatitis C-related deaths have fallen by 12% globally. On sexually transmitted infections, WHO issued a first recommendation for the use of doxycycline post-exposure prophylaxis to help prevent infections among key populations. And fifth, non-communicable diseases and mental health. The UN General Assembly adopted the most ambitious political declaration yet, with concrete targets on tobacco, hypertension, and mental health. WHO also issued new guidelines on the use of GLP-1s for the treatment of obesity in adults. And WHO initiatives on cervical, breast, and childhood cancer are now benefiting over 1 million people in more than 100 countries. In partnership with St. Jude Children's Research Hospital, we delivered 1.5 million cancer medicines supporting treatment for 2,400 children in 5 countries. And I would like to use this opportunity to thank St. Jude for their cooperation and leadership in this area. We also supported 14 more countries to strengthen mental health services for children and young people. Since it launched in 2020, WHO's Special Initiative for Mental Health has expanded mental health services to over 90 million people and enabled first-time treatment for more than 1.5 million children and adults. WHO is supporting 13 countries in the Africa region to improve access to neurological medicines for epilepsy and Parkinson's disease, where the treatment gap is more than 75%. Now to WHO's work to support member states to prevent, prepare for, and respond to health emergencies. Most notably, last year, member states adopted the WHO Pandemic Agreement and the amended international health regulations entered into force. Although member states have not yet reached consensus on the pathogen access and benefit sharing system, the PABS Annex, they have committed to continue negotiations, and I have every confidence that you will finalize it. WHO took many other steps last year to strengthen health emergency preparedness and response in two key areas. First, prevention and preparedness. Through the Pandemic Fund, with the World Bank, WHO supported 70 countries to develop and implement 41 projects to strengthen surveillance, laboratory networks, workforce capacity, and multi-sectoral coordination. 21 countries completed joint external evaluations. 195 state parties submitted their annual IHR reports, and 25 countries completed their National Action Plan for Health Security. The Global Health Emergency Corps ran its second simulation exercise Polaris 2, involving 600 health emergency experts and 25 partner organizations from 26 countries and territories. And just this weekend, we just launched our Global Health Emergency Strategy with a target to have 10% of the world's health workforce ready to respond to emergencies by 2030. The Research and Development Blueprint for Epidemics brought together global expertise to prioritize research and close preparedness gaps for high-risk pathogens, including avian influenza, Rift Valley fever, Oropochu disease, and Ebola. The WHO Hub for Pandemic and Epidemic Intelligence launched an update of the Epidemic Intelligence from Open Source System, or EIOS, which harnesses the power of AI to support more than 120 countries who use the platform every day to quickly identify new threats. Through the International Pathogen Surveillance Network, over 309 partners across 101 countries are also strengthening genomic surveillance to better track pathogens, detect new variants, and guide faster responses to emerging threats. In the past year, the Global Influenza Surveillance and Response System, GISRIS, a network of 165 institutions in 136 countries, tested more than 11 million clinical specimens and shared 65,000 virus samples with WHO collaborating centers. Through the Pandemic Influenza Preparedness Framework, PIP, WHO signed 8 new agreements, giving us access to more than 940 million vaccine doses in the event of an influenza pandemic, as well as antivirals, syringes, and diagnostics. The WHO BioHub coordinated 17 sample shipments to laboratories in 10 countries to guide research and development of countermeasures. We were also on the ground supporting countries to prevent outbreaks of high-threat diseases. We supported preventive vaccination for Ebola for approximately 170 frontline workers in the Central African Republic, DRC, Guinea-Bissau, Uganda, and Sierra Leone. We also established a new stockpile for a monoclonal antibody against Ebola, with hundreds of treatment courses ready to be shipped in 24 hours if an outbreak is confirmed. After a 3-year break, we re-established the preventative cholera vaccination, allocating 50 million doses to Bangladesh, DRC, and Mozambique, thanks in part to a doubling of supply. And to protect against outbreaks of yellow fever, we supported the vaccination of more than 38 million people in the DRC, Guinea-Bissau, Niger, and Uganda. Second, response. In addition to the outbreaks of Ebola and hantavirus that we're responding to now, in the past 12 months, WHO detected 4.2 million signals and supported countries to respond to 50 emergencies in 82 countries, preventing disease spread and saving lives. We released almost $30 million from the WHO Contingency Fund for emergencies to support the rapid response to emergencies in 40 countries. And through the Global Outbreak Alert and Response Network, GORN, we coordinated 58 deployments to support emergency response in 60 countries. As you know, conflict is on the rise in our world, and that's why you see an increase in deployments this year. Last year, we supported the DRC to respond to an outbreak of Ebola, which it controlled within 6 weeks, deploying more than 100 experts, 150 tons of supplies, and vaccinating 47,000 people. In 2025, we also supported Tanzania and Ethiopia to control outbreaks of Marburg virus disease. And in September, I declared an end to Mpox as a public health emergency of international concern. We also continued to respond to the global resurgence of cholera, deploying more than 50 million doses of oral cholera vaccine from the global stockpile. And we launched the first WHO guidelines for the diagnosis and treatment of meningitis and supported the response to meningitis outbreaks with 4 million doses of vaccine. We also continue to work with partners towards our long-held dream of eradicating polio. Last year, 52 cases of wild polio were reported from just 24 districts in Pakistan and Afghanistan, a 50% decline from 2004. So far, this year, 6 cases have been reported. In addition, countries around Lake Chad mounted a joint vaccination campaign that reached more than 83 million children. And with partners, WHO vaccinated over 600,000 children in Gaza, controlling the Strip's first recorded polio outbreak in 25 years. In addition to outbreak response, we also responded to the health needs of millions of people affected by humanitarian emergencies. That included dispatching $150 million of supplies to 97 countries and territories. In Gaza, together with our partners, we organized the transport and shipment of 515 trucks of life-saving emergency health supplies, coordinated more than 82 health clusters, partners, and supported over 2,700 medical evacuations. In Sudan, since the start of the conflict in 2023, we have delivered more than 3,000 metric tons of medical supplies, responded to outbreaks of cholera, dengue, and malaria, and we're providing direct support to hundreds of health facilities. And in Ukraine, we provided almost 20,000 health consultations, supported the medical evacuation of more than 1,200 patients, and provided training to more than 3,000 health workers. In all these places, we continued to see attacks on healthcare as the alarming and illegal new normal of conflict. In 2025, WHO verified 1,385 attacks on healthcare in 19 countries and territories, causing 1,984 deaths and 1,187 injuries among health workers and patients. Of course, WHO does not work alone. As the health cluster lead of the UN Interagency Standing Committee, we coordinate over 1,500 partners. We also coordinated the deployment of more than 100 international emergency medical teams who, together with their national counterparts, provided over 1.8 million medical consultations in more than 17 countries. Excellencies, honorable ministers, Mr. President, these summarize WHO's work to promote, provide, and protect health. Of course, it's a glimpse. As you can see, it's a lot. I have barely scratched the surface. Supporting all of this work are the Secretariat's efforts on the fourth P of GPW14, to power for health through science, data, and digital technology. As WHO moves forward following last year's prioritization and realignment, one of our priorities is to make better use of our network of collaborating centers, which includes over 800 research institutes in 80 countries. That's why in April this year, we convened the first global forum of WHO collaborating centers in Lyon, which involved 577 collaborating centers from all 6 regions and almost 1,200 participants. I would like to use this opportunity to thank His Excellency President Emmanuel Macron for his support and presence during that conference. To strengthen our core mandate on norms and standards, we also launched a 3-year project to modernize the way WHO prioritizes, develops, and disseminates our highest priority guidelines. Also last year, we launched a new global action plan and a new global network to strengthen clinical trials involving 34 major research institutions. And this year, we're celebrating 25 years of Research for Life and HINERI, which makes scientific publications available for free or at very low cost in low and middle-income countries, helping to address inequities in access to scientific publications and strengthening trust in science. Finally, we continue to take steps to make WHO more accountable, transparent, efficient, and effective under the 5th P of GPW14, Perform for Health. We continue to prioritize WHO support to countries by preserving our country presence. Through the work of the Action for Results Group, we have implemented the core country office model, which is helping to achieve an effective, efficient, empowered, and result-oriented, result-focused country presence. We also expanded our evaluation function and improved completion rates. In the past 12 months, WHO's Office of Internal Oversight Services completed 19 audits with no unsatisfactory conclusions. Our investigations function handled 1,174 cases and closed 636 cases. The year-end caseload fell to 656, which is the lowest in 3 years. For the first time, Member States agreed to include a gender equality indicator in the results framework in GPW14, and the Global Risk Management Committee continues to assess the risks to WHO's success. The number 1 risk on its list is tightly earmarked, unpredictable, and non-diversified financing, alongside significant reductions in financing. That's why it's essential that Member States approve the remaining increases in assessed contributions to make WHO more stable, resilient, and independent, as I said in my welcome speech yesterday. Excellencies, honorable ministers, Mr. President, there is no denying that for WHO and the countries we serve, the past year was a difficult one. I would like to place on record my deep respect and gratitude to the WHO colleagues who are no longer with us and to those who still are and who continue to serve the organization and member states with dedication. I likewise thank member states for your support and trust throughout. Thank you so much. This week, you will consider many significant challenges in global health, antimicrobial resistance, malaria, emergencies, and more, as well as the proposal for a member state-led joint process on reform of the global health architecture. For 78 years, this assembly has been where the world meets to confront shared threats with a shared response. Multilateralism is not easy, but it's worth it. National sovereignty and international cooperation are not mutually exclusive. They are mutually reinforcing. When I was in Tenerife last week, supporting the disembarkment of passengers from the MV Hondius under the leadership of Spain, the Prime Minister and Minister Monica, who is here with us, it occurred to me that the cruise ship is a lot like our world. In that small ship, 23, because that's what we do as WHO. It's the same with our world. We're all, because that's what we do as WHO. It's the same with our world. We're all in the same boat. We're stronger, and our driving force this week, the highest attainable standard of health, not as a luxury for some, but a right for all. As Prime Minister Sanchez said yesterday, we need a contagion of solidarity, because we need a contagion of solidarity, because solidarity is our best immunity. I wish you all a very productive 79th World Health Assembly, and I thank you. Thank you so much. I thank you. Thank you so much.
Muchas gracias, Dr. Tedros.
Thank you, Dr. Tedros.
Antes de abrir el debate general sobre el punto 3.
Excellencies, honorable ministers, distinguished delegates, good morning. We are now at a moment to celebrate public health achievements that the Director General elucidated in his distinguished delegates, good morning. We are now at a moment to celebrate public health speech. These are in the countries over the past 12 months that have been confirmed by WHO. Many different public health areas are covered. Communicable diseases, including HIV, hepatitis, syphilis, malaria, and neglected tropical diseases. Risk factors for non-communicable diseases. Come down to the podium to give away the certificates. We begin with the elimination of trachoma. May I call upon Algeria. May I call upon Algeria. Australia. Fiji, Libya, Senegal, Tunisia, please. And last, Egypt. Sorry, there's one more. Next is elimination of human African trypanosomiasis. May I call upon Kenya? Followed by Timor-Leste. Syphilis, Anguilla, Anguilla, Cuba, followed by Denmark. Maldives. Maldives, please. Followed by Montserrat. Next is Oman. Followed by Sri Lanka. Next, we move to elimination of trans fats, Portugal, followed by United Arab Emirates. Next, we move to World No Tobacco Day Awards. May I request Honorable Minister of Health of Liberia, Dr. Louise Maple-Poto. Garcia Gomez, please. Oh, sorry, we have Liberia. My apologies. Tobacco, no tobacco. Now we have Honorable Minister of Health of Spain, Dr. Monica Garcia Gomez. Of Legislation of Vietnam. Congratulations to all the recipients. Thank you, DG. This concludes the session on recognition of public health achievements. May I now hand over the floor back to the President of WHO.
Muchas gracias, doctora Pence.
Thank you very much, Dr.
Para proponer una serie de disposiciones relativas al ejercicio del derecho de réplica, y estas disposiciones son con el fin de garantizar un desarrollo justo, previsible y ordenado de los trabajos en nuestras reuniones, que limiten sus primeras intervenciones a 2 minutos. En caso de que las delegaciones soliciten posteriormente nuevos derechos de réplica sobre el mismo asunto que las réplicas anteriores, ruego a las delegaciones que limiten dichas declaraciones orales a 30 segundos como máximo. Aplicaré esta práctica no solo en relación con el derecho a réplica, sino también en todos los debates. Entendemos y consideramos que es una medida necesaria y esencial, y apelamos y confiamos que esto sea aceptable. Informar a los distintos delegados de que el orden de las intervenciones se determinará con el arreglo a la lista de oradores, a la que se puede acceder en el sitio web de la organización y en la aplicación de la 79ª Asamblea Mundial de la Salud. Las declaraciones regionales y de grupo no podrán exceder de 3 minutos y precederán a las declaraciones de país, que se limitarán a 2 minutos. Se utilizará un sistema de semáforo, y las declaraciones que excedan el tiempo asignado podrán ser acortadas. Tras las intervenciones de los Estados miembros, se dará la palabra a los observadores, a respetar el tiempo asignado. Ahora vamos a abrir el debate sobre el punto 3 y vamos a utilizar un sistema en el cual yo llamaré 2 oradores. Un orador subirá al podio y el otro orador subirá a la tribuna. OMS y la región del Mediterráneo Oriental de la OMS. Invito al primer orador a subir a la tribuna. Mali, por favor, y Kuwait a esperar. Por favor, y Kuwait a esperar.
Come to the podium, and to Kuwait to please wait to speak next.
Membre de votre bureau, le groupe africain exprime sa profonde gratitude au directeur général ainsi qu'à son équipe pour leur dévouement inlassable, et leur leadership exemplaire. Monsieur le Président, le groupe africain s'associe pleinement au thème de cette Assemblée, redéfinir la santé mondiale, une responsabilité partagée. Sous l'égide de l'Agence africaine de médicaments, la sécurisation de nos chaînes d'approvisionnement et la valorisation de notre propre expertise. Sous l'égide de l'Agence africaine de médicaments, la sécurisation de nos chaînes d'approvisionnement contre le paludisme dans plusieurs pays de la région. Monsieur le Président, Le groupe africain rappelle que l'équité ne saurait être un simple idéal moral ou un engagement de circonstance. Elle doit être le pilier juridique et opérationnel de toute architecture sanitaire mondiale. À une gouvernance rigoureuse de ses ressources sanitaires en contrepartie d'un engagement mondial et à ne plus jamais laisser les mécanismes de marché dicter qui doit vivre ou mourir en temps de pandémie. Aussi, une responsabilité partagée exige-t-elle un financement durable, prévisible et flexible. Le groupe africain soutient fermement l'augmentation du financement durable, prévisible et flexible. Le groupe africain en progressif des contributions fixes. Nous appelons l'organisation à poursuivre ses efforts de transformation pour garantir que chaque dollar investi serve efficacement la santé des plus vulnérables.
Subir a la tribuna.
On behalf of the Eastern Mediterranean region, and would ask the Maldives to come up to the platform. Would ask the Maldives to come up to the platform.
سيد الرئيس، أصحاب المعالي والسعادة، سيد المدير العام، السيدات والسادة، يشرفني أن أدلي بهذا البيان نيابة عن الدول الأعضاء في إقليم شرق المتوسط. نتقدم بالشكر الجزيل للسيد المدير العام على تقريره، ونشيد بقيادته في التعامل مع التحديات الواضحة الواقع الذي يواجهه إقليم شرق المتوسط على وجه الخصوص وكذلك العالم بأسره. ولا يزال إقليم شرق المتوسط يواجه أزمات صحية متداخلة تشمل الحروب والنزاعات والطوارئ الإنسانية وفاشيات الأمراض والضغوط المناخية، بما يفرض واقعا متزايد التعقيد على النظم الصحية ويهدد التقدم نحو التغطية الصحية، بل تشمل أيضا حماية البنية التحتية الأساسية المدنية، بما في ذلك المياه والطاقة وطرق النقل وسلاسل الإمداد الآمنة. ويعرب الإقليم عن بالغ قلقه إزاء استمرار التصعيد في عدد من بلدان الإقليم وما يترتب عليه من آثار صحية وإنسانية خطيرة. ففي الأرض الفلسطينية المحتلة بما في ذلك قطاع غزة لا يزال الاستهداف المتعمد للبنية التحتية الصحية الأساسية وتعطل الخدمات الأساسية ونقص الإمدادات الطبية والوقود يفاقم الأزمة الإنسانية بصورة ولبنان واليمن والصومال، فلا تزال الأزمات الإنسانية والصحية المتفاقمة وما يصاحبها من نزوح واسع النطاق وصعوبة الوصول إلى الرعاية الصحية والمساعدات الإنسانية تشكل ضغطا بالغا على النظم الصحية، الأمر الذي يستدعي عملا دوليا منسقا ودعما مستداما للنظم الصحية للمقدرة على الصمود. السيد الرئيس، يجدد الإقليم دعمه للمضي قدما في تنفيذ اتفاقية الجائحة ويؤكد أهمية استكمال عناصرها المتبقية في الوقت المناسب وبطريقة والمعارف الفنية. وتذكر الإنذارات الأخيرة بأن التأهب لا يحتمل الانتظار والإنصاف يجب أن يكون في صميم الأمن الصحي العالمي. وشكرا لاستماعكم.
Ahora cedo la palabra a Maldivas en nombre de la región de Asia Sudoriental.
Deliver the statement on behalf of the member states of the Southeast Asia region. We meet at a critical and challenging, soul-searching, consequential moment for global health. The current landscape, marked by increasing financial constraints, worsening geopolitical complexities, and uneven progress, calls for renewed collective commitment to strengthening how we work together. Ongoing discussions on the global health architecture reform, the UN80 initiative. Mr. President, despite these challenges, the countries of the Southeast Asia region, individually and collectively, have been able to make remarkable progress in key priority areas, from pandemic preparedness to disaster risk reduction and mitigation, real-time disease surveillance to better data generation through digital health, accelerated disease elimination. Our work and the sharpened focus on prioritization have been fully aligned with and guided by the GPW14 and the region's Banyan Framework. In our shared commitment, resolve, and responsibility to promote, provide, and protect health within the confines and constraints of the new global realities, it is paramount that we shift to new paradigms, learning to stand on our own while joining hands to stand taller and stronger. In this context, as we embark on reform, evidence-based decision-making is essential to ensure that global commitments translate into meaningful outcomes at country level. Second, there's a need to secure predictable and sustainable financing grounded in equity and solidarity to safeguard progress towards universal health coverage and security, transparency and shared responsibility. Let us move forward together from fragmentation to coherence and to turning our shared commitments to tangible impact across nations. I thank you.
Ahora cedo la palabra a Libia en nombre de la Liga de los Estados Árabes. Invito a Chipre en nombre de la Unión Europea a subir a la tribuna.
السيد الرئيس، السيد مدير عام منظمة الصحة العالمية، أصحاب الواجهة النظم الصحية. السيد الرئيس، يواصل العمل العربي المشترك تعزيز نهج تكاملي يدعم. السيد الرئيس، يواصل العمل العربي المشترك تعزيز نهج الدول الأعضاء في تطوير سياساتها الصحية ورفع كفاءة خدماتها. وقد أكد إعلان البحرين الصادر عن القمة العربية الثالثة والثلاثين أهمية الارتقاء بالرعاية الصحية في المناطق المتأثرة بالنزاعات وتعزيز صناعة الدواء واللقاحات وضمان الوصول العادل للعلاج بالتنسيق بين جامعة الدول العربية ومنظمة الصحة العالمية. السيد الرئيس، إن الاعتداءات الإيرانية الآثمة التي استهدفت دول مجلس التعاون وعدد من الدول العربية تمثل انتهاكا جسيما لقواعد القانون الدولي وميثاق الأمم المتحدة وتقويضا لمبادئ حسن الجوار وعدم احترام لسيادة الدول وتهديدا مباشرا للسلم والأمن الإقليمي والدولي، فقد تسببت ولما لذلك من أثر على توفير المنتجات الصحية بما في ذلك الأدوية واللقاحات وانعكاساتها على صحة الشعوب واستقرار النظم الصحية على المستوى الإقليمي والدولي. سيد الرئيس، تعمل المرافق الصحية في الأراضي الفلسطينية المحتلة ولا سيما في قطاع غزة بما يفوق طاقتها التشغيلية وسط نقص حاد في المستلزمية، إضافة إلى عدم تمكين منظمة الصحة العالمية في تقييم الأوضاع الصحية هناك. كما أن هذه خطورة الأوضاع الصحية والإنسانية في السودان وما يواجهه النظام الصحي من تحديات جسيمة جراء الحرب الدائرة حيث تضررت المرأة والحد من العوائل. السلام عليكم ورحمة الله وبركاته. السلام عليكم ورحمة الله وبركاته.
Ahora cedo la palabra a Chipre en nombre de la Unión Europea. Invito a China en nombre del Grupo de Amigos de la Gobernanza Global en Ginebra a subir a la tribuna.
Mr. President, Director General, Excellencies, colleagues, I'm delivering this statement on behalf of the EU and its 27 member states, the candidate countries, North Macedonia, Montenegro, Serbia, Armenia, align themselves with this statement. We meet amid intense global instability. The impact of conflicts, humanitarian health emergencies, climate change and growing inequalities strain health systems and the resilience and coherence of the global health architecture. We thank the organization financed and fit for purpose in a highly constrained resource environment. We fully recognize the importance of national responsibility and ownership related to health policies as well as of international cooperation. In line with this, we attach great value to WHO's constitutional mandate, role and functions, including norms and standard setting, advancing health equity, universal health coverage, and global health security. WHO should continue supporting countries in strengthening their health systems, including through health promotion, health emergency prevention, coherence and coordination, and reducing gaps, fragmentation, duplication, and inefficiency among global health actors. We need a future-proof system that focuses on the core functions and a strong WHO at its center. Reform is urgently required, and the time to act is now. We remain committed to work with all partners to find consensus. Is now. We remain committed to work with all partners to find consensus. The EU and its member states remain firmly committed to multilateralism and stand ready to work with WHO and all partners to strengthen global health outcomes while ensuring no person, country, or region is left behind. Thank you.
Ahora cedo la palabra a China en nombre del Grupo de Amigos.
当前，全球卫生治理面临多重挑战，传染病跨境传播、医疗产品可及性不足、卫生领域发展不平衡等问题相互交织。加强全球卫生治理不是选择题，而是各国维护人民健康、促进可持续发展的共同责任。国家的意见和关切是全球卫生治理成果更公平地惠及各国人民。二是坚持多边合作，我们坚持多边合作，我们支持世卫组织在全球卫生治理中发挥核心协调作用，各方以相互尊重、务实协商扩大共识，推动大流行协定附件谈判取得积极成果，提升国际社会防范关注发展中国家人民的实际需要，支持其增强卫生体系韧性和自主防范水平。人工智能等新技术也应以安全、负责任和包容的方式服务人民健康、赋能卫生治理。主席先生，全球卫生治理需要共识，更需要行动。全球治理之友小组愿同各方一道，坚持福祉，共同努力。谢谢主席先生。共同努力。谢谢主席先生。
Ahora cedo la palabra a Kiribati en nombre de los países insulares del Pacífico. Invito a Portugal en nombre de la comunidad de países de la lengua portuguesa. Invito a Portugal en nombre de la comunidad de países de la lengua portuguesa a subir.
22 Pacific Islands, island countries and areas. We are pleased to announce that in October last year, after reflecting on 30 years of progress, Pacific Health Ministers came together and endorsed a new Wealthy Islands Vision 2050. Climate change reminds us that human health and planetary health are inseparable. The Healthy Island Vision 2050 is our response. It is our shared commitment and a more resilient and healthier Pacific, and to deliver on the 2050 strategy for the Blue Pacific continent. The Pacific Ocean spans a third of the Earth's surface and connects over 25,000 islands. Kiribati alone is made up of 33 islands, dispersed across the ocean area, larger than India, yet with a landmass no bigger than and survival. The wire is built without screws and nails, but bound together by rope woven from coconut fiber. In balance, trust, and shared purpose. Its strength lies in force capacity. As an example, this investment has supported Kiribati to pass in the law in April to establish a health promotion foundation to address non-communicable disease. Brothers and sisters, the VA is our canoe. We must establish a health promotion foundation to address non-communicable disease. take our horse, navigate together, and ensure that our shared journey leads to health and dignity for generations to come. Let us embrace the spirit of reshaping global health, a shared responsibility as our call for action. This means recognizing health impacts of climate change as a global priority and strengthening solidarity and partnership so that...
Ahora cedo la palabra a Portugal en nombre de la comunidad de países de lengua portuguesa y pido a Armenia en nombre del Grupo de Estados de la Organización Internacional de Francofonía subir a la tribuna.
Assembly reconfiguring global health, a shared responsibility, reminds us that no country can face current challenges alone and that international cooperation remains essential for effective, solidarity-based and equitable responses. The current international context reinforces the importance of preserving strong, credible multilateral institutions capable of responding to global challenges in a coordinated manner. Health cuts across the three pillars of United Nations system: peace and security, sustainable development, and human rights. Resilient and accessible health systems are essential for social sustainable development. The current situation demonstrates the need to strengthen international cooperation mechanisms capable of responding to complex crises and their impacts on populations. In this context, it is essential to preserve and strengthen international normative frameworks, in particular international humanitarian law, and to ensure the protection of civilian populations as well as hospitals and infrastructure essential for the provision of health services. We recognize that the social and economic inequalities remain among the main determinants of health vulnerabilities, and promoting coordinated responses adapt to regional and local realities. Health security constitutes an essential component of global health. In this regard, we highlight the importance of the negotiations on the pandemic agreement, including with regard to the pathogen access and benefit-sharing system as an instrument to promote greater equity, solidarity and predictability. We further emphasize the fundamental nexus between health and climate change, whose impacts directly affect health conditions.
Ahora cedo la palabra a Armenia en nombre de la OIF y invito a Israel a subir a la tribuna en nombre de los Estados miembros de la Red de Salud de Europa Sudoriental.
Merci, Monsieur le Président. Mesdames et Messieurs les ministres, Excellences, j'ai l'honneur de prononcer cette déclaration au nom du groupe des ambassadeurs francophones. Le groupe francophone salue le choix du thème de cette 79e Assemblée mondiale de la santé, redéfinir la santé mondiale, une responsabilité partagée, qui souligne la nécessité d'un engagement collectif accru pour mener à la réforme en cours au sein de l'OMS, les changements qui se profilent dans l'architecture de la santé mondiale, les défis des avancées technologiques ou encore les menaces, la réforme en cours au sein de l'OMS, les changements qui se profilent dans l'architecture de la santé mondiale, les défis des avancées technologiques ou encore les menaces d'autres crises sanitaires internationales sont autant de facteurs qui influencent le paysage de la santé mondiale accrue et urgence d'action coordonnée. Il ne s'agit plus seulement de gérer des crises ponctuelles, mais de construire des systèmes résilients capables d'anticiper, de prévenir et de répondre collectivement à des menaces sanitaires souvent transfrontalières. Dans ce cadre, la coopération internationale multilatérale apparaît plus nécessaire que jamais, permettant de dépasser les intérêts nationaux d'équité, notamment en matière d'accès aux soins, aux médicaments et aux vaccins. Ce sont là des objectifs visés par l'accord sur les pandémies de l'OMS adopté en 2025. Tout en déplorant l'issue des dernières négociations sur l'annexe de cet instrument, le groupe salue les efforts consentis de part et d'autre, permettant des avancées notables. L'atteinte des objectifs fixés nécessitant davantage plus de compromis, le groupe invite toutes les parties à agir dans ce sens. En plaçant l'accès équitable à la santé de compromis, le groupe invite toutes les parties à agir dans ce sens. En plaçant l'accès équitable à la santé pour tous au cœur des négociations. Le groupe se félicite des résultats du sommet Une seule santé et du Forum mondial des centres collaborateurs de l'OMS, qui ont rappelé l'importance de la science au service de la santé, mettant en exergue la coopération internationale, les partenariats scientifiques mondiaux et la mobilisation des solutions pratiques. En cercle la coopération internationale, les partenariats scientifiques mondiaux et la mobilisation des solutions pratiques en faveur, notamment sa capacité à favoriser l'engagement politique au plus haut niveau, et à mobiliser des financements en faveur du système de santé. Le groupe encourage les États à soutenir davantage ce processus et agir pour sa consolidation. Enfin, le groupe rappelant l'importance du multilinguisme en faveur de l'inclusivité des travaux de l'OMS et de l'accès équitable à ces ressources, appelle l'organisation à poursuivre le régime.
Israel, en nombre de los Estados miembros de la Red Salud de Europa Sudoriental, y Haití a subir a la tribuna en nombre de CARICOM.
Mr. President, Director General, Excellencies, ladies and gentlemen, I have the honor to speak on behalf of 9 member states of the Southeastern Europe Health Network: Albania, Bulgaria, Bosnia and Herzegovina, the State of Israel, Republic of Moldova, Montenegro. The presidency of the State of Israel, SIN, has continued to strengthen regional cooperation through target initiatives focused on health system resilience, digital health, workforce capacity, and demographic transition. The key achievement was the regional workshop on healthy aging in SIN member states and beyond, held in Bar, Montenegro in September 2025, in partnership with WHO Euro and with the support of the Central Europe Sustainable Health Financing. Integrated care models and evidence-informed decision-making through the application of analytic tools. Complementing these efforts, the regional advanced a system approach to workforce resilience. It highlights the importance of leadership, governance, and particular implementation of supporting both health professionals and patient safety. These initiatives reflect the shared common to people-centered resilience and forward-looking health system, while reinforcing a SIN rule as a platform, including digital health, innovations ecosystem, advanced nursing rule, and partnerships, and emergency preparedness. In parallel, SIN countries to promote evidence-informed policy and academic collaboration and valuable support. Thank you.
Ahora cedo la palabra a Haití en nombre de CARICOM y invito a la Federación de Rusia en nombre del Estado de la Unión de Rusia y Belarus a subir.
Personnel pour leur leadership constant de leurs engagements indéfectibles, face aux dynamiques géopolitiques en rapide évolution et aux conflits qui s'intensifient. La CARICOM souhaite souligner l'importance durable du multilatéralisme et de la coopération internationale pour faire face aux urgences de santé publique et aux pandémies qui ne respectent aucune frontière. La CARICOM prend acte des progrès accomplis dans la négociation de l'annexe PABS de l'accord sur les pandémies, tout en reconnaissant que d'importantes questions d'équité demeurent non résolues. Nous estimons que le Sud mondial doit continuer à renforcer sa coordination autour de nos expériences communes vécues, afin de garantir que cet instrument juridiquement transparente et durable. Parallèlement, la CARICOM reste attachée d'un dialogue constructif avec toutes les parties prenantes en vue de trouver des solutions pratiques et opérationnelles pour la mise en œuvre de l'accord. Rappelant le rôle de chef de file de longue date de la CARICOM dans la promotion de l'action contre les maladies non transmissibles, la région demeure profondément préoccupée par la lenteur des progrès dans la réalisation de la cible 3, 4 des ODD et par le fait que de nombreux États ne sont pas en bonne voie pour réduire la mortalité prématurée due au MNT. La CARICOM appelle donc à une mise en œuvre accélérée des engagements mondiaux en matière de prévention et de contrôle des MNT, souhaite par un fonctionnement, par un financement durable et des mécanismes de responsabilité mesurables. Nos États membres continuent d'investir de manière significative dans le renforcement des ressources humaines pour la santé, à travers l'éducation et la formation. Les initiatives de rétention et l'amélioration des conditions de travail. Toutefois, le déficit de personnel en santé continue de se creuser, exacerbé par une migration extérieure intense et soutenue de nos professionnels de santé, ce qui menace la résilience des systèmes de santé. La CARICOM se félicite du rapport du groupe consultatif d'experts sur le code de pratique mondiale pour le recrutement du personnel de santé et soutient ces recommandations, y compris l'examen d'éléments juridiquement contraignants dans le texte. Nonobstant ces défis, la CARICOM son engagement à travailler avec ses partenaires mondiaux et régionaux pour préserver les acquis en matière de santé mondiale et accélère les progrès vers la réalisation des objectifs de développement durable, ODD, à l'horizon vraiment de 2030. Je vous remercie.
Ahora cedo la palabra a la Federación de Rusia en nombre del Estado de la Unión de Rusia y Belarus.
Уважаемый господин председатель, уважаемый генеральный директор, коллеги, мы благодарим генерального директора за представленный доклад, поддерживаем координирующую роль ВОЗ в глобальном здравоохранении и выступаем за его укрепление. Сегодня сотрудничество союзного государства России и Республики Беларусь подает положительный пример профессионального диалога, основанного на принципах солидарности. В наших странах сформированы национальные системы здравоохранения, которые характеризуются высокой доступностью и экономической эффективностью, самой современной медицинской помощью. Принцип доступности и бесплатной базовой медицинской помощи остается одним из фундаментальных приоритетов союзного государства. Мы видим, что уровень удовлетворенности граждан системой здравоохранения растет, ежегодно увеличиваясь на 8%. Реализуемые в наших странах государственные программы обеспечивают повышение доступности первичной медико-санитарной помощи, стационарной помощи, обеспечивают модернизацию и внедрение в практику современных технологий лечения, реабилитации и профилактики детской смертности. Активно реализуются программы по цифровизации здравоохранения, внедряются решения на основе искусственного интеллекта, а также управление отраслью на основе данных. Телемедицинские консультации в прошлом году составили 24 миллиона случаев. Особое внимание уделяется подготовке медицинских специалистов. В нашей стране учатся медицине из 150 стран. Видим рост числа медиков в секторе, оказывающем медицинскую помощь последние 3 года. Эффективность принятых организационных решений подтверждается ключевыми интегративными показателями работы в системе здравоохранения. Прежде всего, уровнями материнской, младенческой смертности. Младенческая смертность сегодня составляет менее 3,4 промилле. Детская смертность до 5 лет за последние 5 лет снизилась на 25%. Это позволяет и система здравоохранения, и телемедицинских консультаций, и система приводят к развитию научного потенциала наших стран и улучшают в целом показатели здравоохранения. Благодарю вас за внимание. Спасибо.
Eso concluye las oratorias de los grupos. Ahora empezaremos con las delegaciones de los Estados miembros. Quiero recordarles a los Estados miembros que el tiempo de oratoria es de 2 minutos, que se usará el sistema de semáforo también, y que las declaraciones que excedan el tiempo podrán ser acortadas. Empezamos invitando a Indonesia a dar su discurso y a Alemania a subir a la tribuna para el podio. Cedo la palabra a Indonesia. Cedo la palabra a Indonesia.
President DG Tedros, Excellencies, in 1944, amid the economic crisis following World War II, leaders gathered in Bretton Woods to reshape the global finance architecture. History has shown us that crises bring opportunities for reform. Today, we face a global health financing crisis, but also a historic opportunity to reshape the global health architecture. For Indonesia, first reform must uphold country ownerships. Global health architecture should support countries in developing their own health programs, health financing, and health equity and resilience through strengthening local manufacturing and R&D capacity. Second, we must address the sustainability of health financing. Countries need to have a clear financing pathway to gradually transition from donor dependence towards stronger domestic financing, complemented by concessional loans from development banks. Third, global health actors and institutions need to be better aligned, reduce duplication and fragmentation, improve efficiency, and channel defunding according to country needs and priorities. Fourth, we need a stronger and more focused WHO, and it should remain focused on their core mandates. And to do it effectively, WHO also needs predictable and sustainable financing. Mr. President, Indonesia supports the joint process to support reforms of the global health architecture, and through this crisis, let us seize this opportunity together to deliver meaningful global health reform for future generations. Thank you.
Ahora cedo la palabra a Alemania e invito a Ucrania a subir a la tribuna.
Mr. President, Director General, dear colleagues, Germany aligns itself with the statement delivered on behalf of the European Union and its 27 member states. Global health continues to face significant challenges. However, as emphasized by the recent outbreaks of Ebola and hantavirus, national health depends on multilateral solutions and cooperation, with WHO at its center. Without WHO structures and activities, including in health security and AMR, national health systems are at risk. In order to lead by example, WHO must focus on its core mandate and comparative advantage. More than ever, we need to avoid duplication and fragmentation. This also means building new and efficient ways of collaboration with our partners in the global health architecture. We, as member states, share the responsibility to support, guide, and strengthen WHO. We need everyone's expertise and participation, including Taiwan's. Dear Dr. Tedros, please rest assured that Germany remains a reliable partner. We will continue to support WHO in every way we can, politically, technically, and financially. Therefore, I am pleased to announce today that Germany will 25 million euro this year, because now is the time for strong leadership and for a clear focus for strategic and bold decisions. The ongoing reform brings not only challenges but also opportunities. It is our chance to demonstrate why global collaboration and multilateralism matters. Thank you.
Ahora cedo la palabra a Ucrania. Invito a Islas Marshalls a subir a la tribuna.
And I invite the Marshall Islands to approach the rostrum.
Excellencies, for more than 4 years, our healthcare system has been operating under full-scale aggression. Hospitals, ambulances, and energy infrastructure continue to be under attack. Yet Ukrainian doctors and healthcare workers continue saving lives every day during blackouts, missile attacks, and constant security threats. We are deeply grateful to the WHO, Dr. Tedros, to the country office in Ukraine, led by Jarno Habicht, and to all partners supporting Ukraine throughout these years. Today, Ukraine is focusing not only on responding to the challenges of the war, but also on the further transformation of its healthcare system. The combination which defines key priorities including rehabilitation, mental health, healthcare worker development, including rehabilitation, mental health, healthcare worker development, and equal access to healthcare services. Recognizing the long-term impact of war on society, Ukraine is also advancing a nationwide mental health initiative under the leadership of the First Lady of Ukraine, aimed at making mental health support accessible, community-based, and integrated into everyday life. The war has profoundly changed healthcare realities. Ukraine has gained unique experience in trauma care, rehabilitation, and maintaining healthcare services under conditions of war. At the same time, one principle must remain the absolute. Attacks on healthcare must never become normal. The decision adopted by this Assembly regarding the health emergency in Ukraine in 2022 remains critically important. Their continued implementation sustained international attention to the health consequences, continue defending the principles of humanitarian law, transparency, and responsible international cooperation. Ukraine highly values its partnership with the World Health Organization, and together defending the principles of humanitarian law, transparency, and responsible international cooperation. We will build a stronger global health resilience in the future. I thank you.
Ahora cedo la palabra a Islas Marshalls e invito a Vietnam a subir a la tribuna.
Vietnam to approach the rostrum.
Mr. President, Director General, Honorable Ministers, Excellencies, distinguished guests, and delegates. Reflecting on the theme of the Gejugan, which means accomplishment through joint effort. It is this call that we want to be heard from the distant shores of our atoll nations, to advance global health efforts in a collaborative, fair, and inclusive manner. Together with other small island developing states, Marshall Islands face distinct health threats and carry a disproportionate burden relating to impacts of climate change on health, nutrition, and prevention of NCDs. These health threats place a considerable strain on SIDS health systems, which are already challenged with a plethora of technical and capacity constraints. In turn, this undermines our economic resilience and deepens existing structural, but also about doing better and more, most importantly, together. In this regard, we urge member states to hear the voices of SIDS, including across the Pacific, and acknowledge our special circumstances. Support must be provided to SIDS to strengthen our capacity to respond to health emergencies, including those resulting from climate change, and safeguard the fundamental human rights of health for our people prior to 2017. Thank you, Thank you, Komoltata, and Mr. President.
Ahora cedo la palabra a Vietnam. Ahora cedo la palabra a Vietnam. Invito a Perú a subir a la tribuna.
Peru to approach the tribune.
Kính thưa tiến sĩ Tedros,
Dr. Tedros, Director General of the World Health Organization, Honorable Minister, distinguished delegates, it is a great honor for me, on behalf of the Vietnamese delegation, to speak at the 79th session of the World Health Assembly. The Assembly theme this year is an urgent call to action. In this context, Vietnam would like to emphasize three key pillars. First, primary health care, universal health coverage must be built on a strong foundation. We are determined to reform primary health care to ensure all people, including those in remote areas, has access to comprehensive quality services. Second, global health security. We need access to vaccine and treatment. The third, climate change. Vietnam is among the countries most vulnerable to climate change. We are transforming our health system to adapt and mitigate threats. Efforts that we benefit from international support. Reshaping global health is not merely about changing legal texts, but about changing mindset. We must shift from passive response to proactive prevention, from competence to cooperation. Great success. Thank you very much. Great success. Thank you very much.
Ahora cedo la palabra a Perú. Invito a Irlanda a subir a la tribuna. Ahora cedo la palabra a Perú. Invito a Irlanda a subir a la tribuna.
Excelencias, distinguidos delegados, es un honor dirigirme a esta asamblea en nombre de Perú en un momento decisivo para el multilateralismo y la cooperación en salud pública global, en un mundo marcado por continuos desafíos sociales, económicos, ambientales y los conflictos armados que impactan profundamente el acceso a servicios de salud, la calidad de vida y el bienestar general, en particular el de las poblaciones más vulnerables. De forma orientada a superar la fragmentación, fortalecer la atención primaria y acelerar la transformación digital e interoperabilidad para mejorar la continuidad del cuidado. Para países como Perú, la salud pública es un desafío cotidiano que exige equilibrar necesidades urgentes con recursos limitados. Priorizamos un enfoque preventivo basado en el curso de vida, con énfasis en reducir la anemia infantil, recuperar coberturas de inmunización, fortalecer el control de enfermedades crónicas, ampliar la respuesta de materiales de información sobre secuencias digitales de patógenos, que es el núcleo de la negociación actual para el acuerdo de OMS sobre pandemia, lo que permitirá la pronta entrada en vigor de dicho acuerdo y constituirá una garantía para la humanidad ante futuras crisis sanitarias. Muchas gracias.
Thank you very much for your attention.
Ahora cedo la palabra a Irlanda e invito a Finlandia a subirle a la tribuna.
Know that scientific progress, innovation and continued international cooperation gives us great grounds for optimism. Ireland's belief that global health must remain grounded in solidarity, equity, and equity must remain at the centre. Grounded in solidarity, equity, and equity must remain at the centre of what we do. This includes sexual and reproductive health and rights, ensuring that health systems are inclusive. Delivering on global health requires investment in health workforce through education, fair recruitment practices, and ability as members of the international community. We must continue to implement lessons learned from our response to COVID-19, which demonstrated the vulnerabilities in the global health systems, but also the potential of scientific collaboration. The operationalisation of the international health regulations and the ratification of the pandemic agreement is so important, and we must be further than we were before COVID-19. We need only to look at the cluster of hantavirus infections and Ebola outbreak in the past 2 weeks to be confident of this. Ireland will continue to work with partners to deliver a stronger, fairer and more resilient globe. We are so proud of Mike and so proud to call him one of our own and wish him continued success. Thank you.
Ahora cedo la palabra a Finlandia y pido a Luxemburgo que suba a la tribuna.
Honourable President, Director General, dear colleagues and delegates. Finland aligns itself with the EU statement. Global collaboration is undergoing fundamental changes, some overdue and necessary in the long run. In this evolving landscape, we must safeguard the mechanisms for the hantavirus emphasizing the low likelihood of broader transmission, underscores the continued relevance of these strong and well-functioning structures. We highly value the role of WHO in humanitarian crises and settings. We are extremely concerned about the continued attacks on healthcare and civilians, a clear breach of international humanitarian material support, including through WHO Europe. WHO's core mission as a convener and leader in global health and health security, as well as in setting science-based standards and norms, is important to us. We appreciate WHO's adjustments to the new situation and the reforms that will continue to fine-tune its governance. Mr. President, political commitment to health is a strategic economic decision. Finland emphasizes the relevance of economics of health for all, underlining the mutually reinforcing nature of well-being and economic growth. Thank you.
Monsieur le Président, Monsieur le Directeur Général, Mesdames, Messieurs les ministres, chers tous. Le Luxembourg soutient pleinement la déclaration de l'Union européenne et remercie le Directeur général et le personnel de l'OMS pour leur engagement inlassable en faveur de la santé pour tous. Renforcer la prévention tout en investissant dans des systèmes de surveillance robustes. Soutenir la recherche scientifique pour guider nos l'intelligence artificielle doivent bénéficier à tous. L'intelligence artificielle doivent bénéficier à tous. C'est pourquoi il est impératif de conclure les négociations sur l'annexe PAPS du traité pandémie sans retarder. Monsieur le Président, repenser la santé mondiale exige une coopération renouvelée entre États, organisations internationales, acteurs privés et sociétés civiles. À cet égard, nous rappelons que toute expertise technique doit pouvoir être mobilisée. C'est pourquoi nous continuons à soutenir la participation de Taïwan aux réunions techniques de l'OMS en tant qu'observateur. Chers toutes et tous, il y a une souche pour laquelle aucun vaccin n'est actuellement disponible. Nous saluons l'approche de précaution adoptée par le directeur général en déclarant cette épidémie comme étant une urgence sanitaire à portée internationale et nous accueillons très favorablement le déblocage rapide des fonds du mécanisme de réserve pour les interventions d'urgence. Merci pour votre attention.
Cedo la palabra a Japón. Invito a España a subir a la tribuna.
Given the increasingly severe challenges to global health, there is an urgent need to advance WHO reform and to rebuild the global health architecture. Japan expresses its respect and support for the efforts of the WHO Secretariat, led by Director General Tedros. Japan will contribute actively to these discussions. In advancing its reform, WHO must return to its core mandates, namely the evidence-based norm-setting role, the leadership and convening role in global health, and the coordination and guidance role in infectious disease emergency in collaboration with WHO and the World Bank. Japan is also planning to host the UHC High-Level Forum again on December 12th this year in Tokyo, continuing to contribute to the achievement of UHC worldwide. In the response to health emergencies, including pandemics, there should be no geographical vacuum. We should draw upon the experiences of regions that have achieved notable public health outcomes, such as Taiwan. On the pandemic agreement, Japan will continue to engage constructively in the discussions to ensure that the system for pathogen access and benefit sharing is operational resolutely against any attacks against medical personnel facilities and calls for protection for healthcare in situations of armed conflict in compliance with international humanitarian law. Japan reaffirms its unwavering commitment to achieve health for all, together with WHO. Thank you very much.
Ahora cedo la palabra a España e invito a Australia a subir a la tribuna.
Queridos presidente, director general, queridos colegas, España se alinea plenamente con la declaración. ¿Qué tipo de mundo queremos construir para los próximos 10, 20, 30 años? Si uno basado en la cooperación y en el cuidado mutuo, o uno marcado por el miedo, por la desigualdad y el sálvese quien pueda. España lo tiene claro. Creemos en una salud global basada en la ciencia, en los sistemas públicos fuertes, en la cooperación entre países y en la dignidad humana. Porque si los virus no conocen fronteras, tampoco deberían conocerlas la solidaridad con decenas de países, poniendo nuestros recursos sanitarios, científicos y logísticos al servicio de las personas de múltiples nacionalidades. No preguntamos de dónde venían esos pasajeros ni quiénes eran. Entendimos que cuando llega una crisis, la única prioridad posible es la humanidad. Hemos demostrado que el compromiso de España con la negociación del Tratado de Pandemias no era retórico y en cuanto hemos tenido la oportunidad hemos demostrado con hechos nuestro compromiso con la salud global y con el multilateralismo. Ahora con el nuevo brote de Ébola en República Democrática del Congo nos debemos guiar por los mismos principios y tenemos una nueva oportunidad de demostrar el valor de la cooperación internacional. Pero hoy no podemos hablar de salud global ignorando el sufrimiento del mundo. España quiere expresar su más firme condena ante el horror que continúa viviendo la población civil en Gaza y que se ha extendido al Líbano, la crisis humanitaria de Sudán y el reciente conflicto del Golfo Pérsico. Una vez más, lo decimos, no hay salud posible bajo las bombas, no hay salud posible entre las ruinas, ni hay salud y paz global sin paz y derechos humanos. Hoy necesitamos más OMS y menos negacionismo, más cooperación y menos egoísmo, más ciencia y menos indiferencia. Hagámoslo. Muchas gracias.
Ahora cedo la palabra a Australia e invito a Dinamarca a subir a la tribuna.
Australia is honoured to address the Assembly at a pivotal moment for global health. As outgoing Chair of the Executive Board, I thank you for your trust and partnership. Global health is a shared responsibility. The World Health Organisation's essential role is clear. Only WHO can unite nations around shared rules, trusted evidence and coordinated health action, part of an ecosystem of trusted multilateral institutions that underpin global stability. When WHO is strong, the world is safer, better prepared for future crises. Strengthening health security and pandemic response is crucial. Australia remains deeply concerned about the safety of humanitarian and health workers in conflict zones, and we are committed to the implementation of the Declaration on the Protection of Humanitarian Personnel. Those who save lives must be respected and protected, able to operate safely without fear. Australia also remains firmly of the view that global cooperation for health should engage all partners, including Taiwan. As member states, this is our organisation. The governance reforms we have all advanced will ensure meaningful engagement by small and large countries alike and ensure WHO remains responsive to all of us. We urge all member states to sustain this momentum on reform. At home, Australia is reforming health, aged care and disability systems, tackling chronic disease, closing the gap for First Nations peoples and strengthening prevention, mental health and innovation. Our focus is on a sustainable health system that works for everyone. We remain firmly committed to advancing equity and inclusion to ensure healthcare remains accessible and affordable for all, regardless of income, location, age, gender identity, sexuality or disability. And we are also committed to helping our next generation. Our world-first reforms to limit social media access for under-16s will keep our young people safe and support their mental health and well-being. Australia reaffirms its unwavering commitment to the World Health Organization. Thank you.
Ahora cedo la palabra a Dinamarca e invito a Chile a subir a la tribuna.
Thank you, Chair. Director General, dear colleagues. Denmark aligns itself with the statement made on behalf of the EU and its member states. We reaffirm our strong support for the WHO as a central coordinating, convening and guiding organization in global health. WHO's normative, evidence-based, and standard-setting role forms the foundation of the global health system. In a changing and complex landscape, our institution must evolve to remain effective, responsive, and relevant. Reforming the WHO, the global health architecture, as well as the UN80 initiative are essential for building a more flexible, sustainable, and adaptive system fit for today's needs and the challenges of tomorrow. As reforms move forward, one principle must remain clear. WHO's normative authority must be protected. The world needs an independent institution capable of delivering evidence-based guidance rooted in science, equity, human rights, and the shared goal of health for all. Denmark welcomes a joint process hosted by WHO to support reforms of the global health architecture. We remain fully committed to the UN, to effective multilateralism, and to bringing together current reform efforts to improve health for all. Bringing us together as colleagues is the true superpower of the WHO, allowing us to speak with one another, meeting us, listening, learning from each other. The relationship we build and the conversation we share form the foundation for sustainable healthcare solutions for the future. This is valuable, and I look forward to continuing our collaborations with you all. Thank you.
Cedo la palabra a Chile. Invito a Nigeria a subir al estrado.
Señor Presidente de la Asamblea Mundial de la Salud, Director General, Ministras y Ministros de Salud, autoridades, delegadas y delegados. Chile agradece la oportunidad de participar en la Asamblea Mundial de la Salud número 79. Un espacio fundamental para renovar nuestro compromiso con la cooperación internacional, el multilateralismo y la protección de la salud de nuestras poblaciones. Nos reunimos en un momento de grandes desafíos, pero también de enormes oportunidades. La experiencia reciente nos ha demostrado que cuando los países cooperan, cuando la ciencia orienta las decisiones y cuando los sistemas de salud incorporan innovación con sentido público, podemos responder mejor, proteger más vidas y construir sociedades más resilientes. Chile reafirma su compromiso con el rol de la Organización Mundial de la Salud y valora los avances hacia una arquitectura sanitaria internacional más sólida, incluyendo el acuerdo sobre pandemias y la implementación del Reglamento Sanitario Internacional. Prepararnos mejor frente a futuras emergencias es una responsabilidad compartida y una inversión en seguridad, bienestar y confianza. En este contexto, Chile está impulsando una agenda sanitaria centrada y con las personas, donde la transformación digital ocupa un lugar estratégico. La interoperabilidad de los sistemas, la telesalud, la inteligencia artificial, la gobernanza de datos y el uso seguro de la información sanitaria son herramientas fundamentales para mejorar la oportunidad de la atención y tomar mejores decisiones clínicas y de salud pública. Esta transformación debe avanzar con responsabilidad, protección de datos, transparencia y confianza ciudadana, siempre al servicio de una atención más oportuna, integrada y cercana a las personas. Junto con ello, Chile ha definido el cáncer como una prioridad sanitaria de primer orden. Como ocurre en muchos países, enfrentamos una carga creciente de enfermedad oncológica asociada al envejecimiento de la población, a los factores de riesgo y a las brechas persistentes, principalmente en diagnóstico oportuno. Por ello, nuestro país está fortaleciendo una respuesta integral frente al cáncer, con énfasis en prevención, detección temprana y continuidad de cuidados. Esta prioridad expresa una convicción central. Avanzar en cáncer implica organizar mejor el sistema para llegar antes, acompañar mejor y reducir inequidades en salud. Chile mantiene además prioridades claras en enfermedades crónicas. Señor Presidente, Chile llega a esta asamblea con voluntad de diálogo, espíritu constructivo y compromiso con una agenda global basada en la equidad, la evidencia, la innovación y cooperación. Reiteramos nuestra disposición a trabajar con la OMS y la OPS. Muchas gracias.
Ahora cedo la palabra a Nigeria e invito a Polonia a subir al estrado. Por favor, les pido mantener el tiempo, es importante.
Mr. President, Director General, Excellencies, distinguished delegates, we meet at a moment of profound transformation in global health. The financing landscape has narrowed. Geographical instability has displaced more people than at any point in recent memory. Pandemic and outbreak remains ever present, and yet the multilateral system we built to confront them is being tested as never before. The provisional theme of this assembly, to provide, protect, promote health, could not be more timely. Nigeria believes that this is not a moment to retreat from global solidarity, but to reaffirm on its terms that a country-led, equitable, and sustainably in spirit of Lusaka agenda. On the substantive items of this assembly, Nigeria takes the following position. On the economics of health for all strategy 2026 to 2030, we strongly endorse the framing that domestic investment in health is the foundation of sustainability. We call on partners to align their support with country-led defined priorities. On the pandemic agreement and its pathogen access and benefit sharing annex still being negotiated, Nigeria's position is clear and unwavering. The agreement is a historic instrument, but it will be more measured not by elegance of its preambles, but by the fairness of its operational core. Nigeria will only support a system that addresses all inequalities so that the agreements can enter into force and protect the world's vulnerable population. On the international health regulations and WHO work in health emergency, we reaffirm our commitment to full implementation and to strengthening regional manufacturing vaccines and domestic therapeutic through African Partnership for Vaccine Manufacturing. Before I conclude, permit me to announce that Nigeria has the honor of hosting the 5th Global High-Level Meeting Conference in Antimicrobial Resistance in Abuja from 28 to 30 June 2026. This conference will convert the commitment of the 2024 United Nations High-Level Meetings into concrete country-led actions and to extend personal invitation to all member states and to partners to join us in Abuja as we stand ready to welcome the world. I thank you.
Ahora cedo la palabra a Polonia e invito a Mónaco a subir al estrado.
Dear President, dear Director General, dear Ministers, dear colleagues, Poland aligns with the EU statement. I thank the Director General for his speech. I also thank him and the entire WHO staff for their dedication and ongoing efforts to promote health for all. Nowadays, international cooperation is becoming more and more challenging. Many people have limited access to medical help. The global health system is also changing. We thank the WHO for its quick and strong reaction to this. We must work harder and in cooperation so that everyone can enjoy good health. Poland reminds that armed conflicts cause great suffering of people and destroy health systems. We call for an end to all wars, including the unprovoked Russian aggression against Ukraine. We need stronger humanitarian and medical response to such crises and long-term strategy to rebuild health systems. We should focus even more on health systems resilience and international support in conflicts and crises. There are also other important topics on our agenda for this week. Mental health is a big challenge, especially for children and young people. We must protect the health of our children and support their development. Our society is getting older. This happens in many WHO regions. We must adapt our health system to this change. In this context, shortage of medical personnel is a huge challenge for us. New technology brings chances but also risks, so we must act wisely and responsibly. I wish to thank WHO for its ongoing support and leadership in global health. Thank you.
Cedo la palabra a Mónaco e invito a Irán a subir a la tribuna.
Monsieur le Président, Monsieur le Directeur Général, Excellences, Mesdames et Messieurs, chers collègues, redéfinir la santé mondiale relève d'une interrogation profonde. Comment avancer ensemble dans un monde plus fragmenté, plus contraint et plus incertain? Les tensions géopolitiques s'exacerbent, les financements se contractent, les vulnérabilités s'aggravent, tandis que les attentes à l'égard de nos institutions ne cessent de croître. Dans ce contexte, la responsabilité partagée, objet de notre débat, ne peut être une simple formule. Elle relève d'une exigence politique et doit être une méthode articulant coopération internationale et souveraineté nationale. Pour l'OMS, cela suppose un retour résolu aux fondamentaux. Son mandat normatif est irremplaçable et doit être conforté. Ce recentrage appelle aussi à une plus grande cohérence de notre architecture collective, une meilleure rationalisation des actions, plus de synergie entre les institutions et agences, une plus grande complémentarité et efficacité dans nos systèmes au service de l'intérêt supérieur des populations. Cette exigence vaut également pour la gouvernance. Une réforme ambitieuse est apparue nécessaire pour permettre à l'organisation de répondre avec davantage de lisibilité, d'agilité et d'impact aux besoins de toutes et tous. C'est en poursuivant ce but que nous pourrons progresser sur les grands défis qui restent devant nous, tels que la couverture sanitaire universelle, le renforcement des systèmes de santé et la prévention, y compris dans l'esprit de l'approche « Une seule santé ». S'agissant de nos travaux normatifs en cours, notamment les négociations relatives à l'accord sur les pandémies, Monaco appelle à poursuivre l'effort avec responsabilité afin d'aboutir à un cadre rationnel et réaliste utile à chacun. La principauté réaffirme son engagement auprès de l'OMS, un engagement constant au service d'un multilatéralisme efficient, exigeant et fidèle à sa raison d'être. Je vous remercie.
Cedo la palabra a Irán e invito a Burkina Faso a subir a la tribuna.
Mr. President, Director General, Excellencies, distinguished delegates. Today, I speak from a nation under unprovoked attack, not only against its army, but against its civilians, its children, its environment, and its health infrastructure. Just days ago, a school in Minab was struck. 168 child students and teachers were killed at their desks. These were not combatant. They were children with dreams. The numbers are horrifying. 376 under 18 years are killed and more than 33,000 civilians are injured, a clear evidence of indiscriminate attacks on civilian targets. 63 hospitals and 195 other health infrastructures are damaged. Let us recall the words of WHO Director General himself, Dr. Tedros. Bombing a hospital or a school is not a miscalculation. These are war crimes, full stop. And let me be clear, the Pasteur Institute of Iran, a pillar of our country's health system for over 100 years, has been directly hit. Excellencies, attacking a school or hospitals is attacking the future and ethics fundamental. Iran's call on this assembly to condemn an attack on civilians and civilian health infrastructure. Yet, despite all these attacks, our health systems continue to function with pride. We will not be broken. We will not be broken. And our national team of health stands with the people of Iran in any condition. Health can and must remain a bridge of peace.
Ahora cedo la palabra a Burkina Faso y invito a Cuba a subir a la tribuna.
Monsieur le Président, Monsieur le Directeur Général, distingués délégués, la vision pragmatique du président du Faso, chef de l'État, le camarade capitaine Ibrahim Traoré, de bâtir un système de santé équitable, résilient, inclusif et souverain est plus que claire et concrète. À titre illustratif, on peut citer entre autres les acquis suivants. 12% du budget de l'État alloué au ministère de la Santé et le manifeste de la révolution progressiste populaire annonce même une augmentation significative de ce niveau de financement les années à venir. Le recrutement et la mise en formation spécialisée en 2025 de 1970 médecins, pharmaciens, chirurgiens dentistes dans le cadre du plan 1000x5. Une réduction historique et sans précédent de 32% des cas et de 44% des décès liés au paludisme par rapport à 2024. L'accès à un paquet de services essentiels de santé et de nutrition à plus de 10 millions d'enfants de moins de 5 ans et à plus de 7 millions de femmes. C'est plus de 230 000 femmes qui ont bénéficié de dépistage des lésions précancéreuses du col de l'utérus, plus de 42 000 mammographies réalisées gratuitement et majoritairement au profit des femmes du milieu rural. La transplantation rénale désormais disponible, la réalisation de chirurgies à cœur ouvert, positionnant le pays à la 4e place en Afrique au sud du Sahara en termes d'intensité de cette activité. L'ouverture d'un nouveau centre hospitalier universitaire moderne, de 2 nouveaux centres de radiothérapie et de plusieurs formations sanitaires de base. Mesdames et messieurs, notre pays reste engagé en faveur d'un multilatéralisme axé sur nos objectifs communs en matière de santé. Pour terminer, le Burkina Faso réaffirme son soutien au principe d'une seule Chine conformément au droit international. Je vous remercie.
Cuba tiene la palabra. Invito a Singapur a subir a la tribuna.
Señor presidente, Cuba acude a esta asamblea a denunciar una situación de extrema gravedad. Nuestro país está bajo amenaza de una agresión militar directa de los Estados Unidos. Nada justificaría un acto tan brutal e incivilizado por parte de la superpotencia. Llamamos a todas las naciones amantes de la paz a movilizarse para impedir esta agresión. El pueblo cubano defenderá su soberanía e independencia. Estados Unidos ha impuesto un bloqueo de combustible total a Cuba, que se suma a un bloqueo económico ya recrudecido. Es una acción con grave impacto en nuestro sistema de salud, que ocasiona un daño extraordinario a cada familia cubana, a nuestros niños, ancianos y enfermos. Cuba, que garantiza acceso universal y gratuito para el 100% de la población, a pesar de los esfuerzos, la mortalidad infantil se ha duplicado, alcanzando 9,9 por cada 1000 nacidos vivos. La tasa de supervivencia de los niños que padecen cáncer descendió de 85 a 65%. Hoy las listas de espera quirúrgica en el país sobrepasan los 100.300 pacientes. 12.000 de ellos son niños. 16.000 pacientes requieren radioterapia y 3.000 personas dependen de hemodiálisis. Estos servicios demandan una estabilidad energética que hoy no es posible garantizar en Cuba. Provocar escasez y penurias extremas a millones de personas no es otra cosa que genocidio y merece la condena de todos los miembros de la OMS. A pesar de los desafíos, el Sistema Nacional de Salud no ha colapsado. Nos continuaremos reorganizando, basados en la resiliencia y optimización de los recursos. Cuba resistirá. Nuestra profunda gratitud a todos los que nos brindan su apoyo y solidaridad en estos momentos difíciles. Cuba nunca renunciará a sus principios humanistas, como demostramos enviando 3 brigadas médicas a combatir el ébola en África Occidental en 2014. Continuaremos prestando apoyo a otros países del sur que lo necesiten. Siempre se podrá contar con Cuba en los esfuerzos para hacer realidad el derecho humano a la salud. Muchas gracias.
Singapur tiene la palabra. Invito a Nepal a subir a la tribuna.
President, Excellencies, ladies and gentlemen, I deliver this national statement on behalf of Mr. Ong Ye Kung, Minister of Health and Coordinating Minister for Social Policies. We are gathered at the World Health Assembly today when the WHO has undergone steep budget cuts. Yet, being leaner can also be an opportunity if the WHO reshapes itself decisively. Today, I put to you just one idea. More than ever, the WHO must further develop partnerships. When resources are tight, we must better leverage the expertise and capital of others. Over the decades, the WHO has built important partnerships. For example, CEPI fills up an important gap in developing life-saving vaccines when market incentives are weak. Gavi complements this by advancing equitable vaccine access. Their work today is made possible through the contributions of philanthropic organizations such as the Gates Foundation, Wellcome Trust, and Bloomberg Philanthropies. Looking ahead, our challenges call for a new generation of partnership suited for the times. These include partnerships with organizations with strong networks and surveillance capabilities to spot the emergence of pathogens that may spark the next pandemic. Partnerships with technology companies to harness the power of AI can predict the onset of non-communicable diseases and strengthen preventive care and healthy aging. Partnerships, perhaps with a panel of reputable regulatory jurisdictions around the world to establish international benchmarks, expedite regulatory approvals, and time-to-market medical countermeasures in support of the WHO's mission. Singapore is honoured that WHO has awarded Singapore Health Service the prize for research in healthcare for elderly and health promotion, and accorded Health Services Authority of Singapore the highest maturity level 4 recognition for medical device regulation.
Mr. President, Director General, Excellencies and distinguished delegates, Namaskar. On the behalf of the government and the people of Nepal, I extend warm greetings to this assembly. Today's interconnected crisis demand global action, equitable access to medical resources, and robust pandemic preparedness. Nepal reaffirms that a strong, adequately financed WHO is essential to coordinate this shared responsibility. Excellencies, despite the limited resources and challenging geography, Nepal is advancing robust primary health care. We have sustained strong immunization, improved maternal, newborn, and child health, and introduced HPV vaccine into routine care. 8 hurdles remain. We faced rising non-communicable diseases, antimicrobial resistance, and solve climate-induced health threats, despite our minimal global emissions. Health is a fundamental human right, not a privilege. Driven by this, we are restructuring our national health architecture and health insurance system. We are enforcing nationwide basic health standards and leveraging telehealth to bridge geographical divides. We are redefining inclusive care by integrating disability rehabilitation into primary health and making mental health a strategic pillar. Recognizing our heritage, we are scientifically institutionalizing Ayurveda, yoga, and natural therapies while promoting the global health tourism to share these traditions with the world. Nepal calls for an equitable global health system that truly responds to country needs. Let us act together, ensuring everyone, everywhere realizes their right to health. Dhanyavad, thank you, and once again, namaste to everyone.
Cedo la palabra a Francia e invito a Lituania a subir a la tribuna.
Monsieur le Président, Monsieur le Directeur Général, cher Dr Tedros, chers collègues, la France s'associe à la déclaration de l'Union européenne. L'épisode d'hantavirus et l'urgence de santé publique de portée internationale déclarée d'Ebola auxquels nous faisons actuellement face nous rappellent l'absolue nécessité du multilatéralisme et d'une coopération sanitaire internationale forte. Je veux à ce titre saluer l'extrême réactivité de l'OMS ainsi que la mobilisation de l'ensemble de mes homologues concernés. Plus que jamais, il nous appartient de renforcer notre coopération et de soutenir l'OMS. C'est l'engagement de la France. 3 axes sont aujourd'hui prioritaires. Premièrement, la réforme de l'architecture de santé mondiale. Le processus conjoint hébergé par l'OMS est une opportunité décisive pour renforcer nos systèmes de santé et, in fine, garantir la couverture sanitaire universelle. La France salue les efforts courageux rappelés par le Dr Tedros. Ce processus ambitieux et pragmatique doit être adopté par cette Assemblée. Deuxièmement, l'approche Une seule santé. La France appelle à capitaliser sur les acquis du One Health Summit de Lyon et la nécessaire mise en œuvre de ces engagements par les États et les Nations Unies. L'OMS, présidente de la quadripartite, y jouera un rôle clé. Troisièmement, l'accord pandémie. L'actualité nous rappelle collectivement l'importance d'aboutir rapidement. Nous réitérons notre volonté d'une adoption rapide de l'annexe PAPS. Cet accord est essentiel pour renforcer notre préparation collective face aux futures pandémies. La France restera pleinement mobilisée pour aboutir à une conclusion des négociations au plus tard d'ici la prochaine Assemblée, avec une exigence claire, solidarité, responsabilité et équité. Cela nécessite que toute la communauté internationale en bénéficie. Je tiens à rappeler que la France est favorable à la participation de Taïwan aux travaux de cette Assemblée. Je vous remercie.
Cedo la palabra a Lituania. Invito a Turquía a subir a la tribuna.
Chair, Mr. Director General, Excellencies, distinguished colleagues. Lithuania fully aligns itself with the statement made by Cyprus on behalf of the EU and the Member States. The theme of this Assembly reflects the health threats transcend borders. Geopolitical instability, pandemics, and climate change have shown the need to move from crisis response to collective resilience. Lithuania believes this evolution begins with the establishment of resilient, strong, and equitable national health systems. To this end, we are actively strengthening primary care, improving accessibility, and leveraging digital health innovations to build more responsive systems. We also emphasize that mental health must remain a central public health priority, particularly as we address the growing challenges facing young people in the digital age. In addition, Lithuania continues to strongly condemn the Russian war of aggression against Ukraine, as the deliberate targeting and destruction of healthcare infrastructure are direct attacks on the stability of the international community. Additionally, we must ensure that no gaps are left in our global network. Therefore, we urge the WHO to invite Taiwan as an observer to the WHA and to facilitate its meaningful participation. Looking ahead, reshaping global health requires a strengthened workforce and multi-sectoral cooperation. We must reinforce the WHO as the leading authority, and to this end, we support the ongoing negotiations on the pandemic agreement and PAP system. Lithuania remains committed to advancing a global health architecture that ensures collective resilience for the future. Thank you.
Cedo la palabra a Turquía. Invito a Sri Lanka a subir a la tribuna.
Esteemed Director General, Honorable Ministers, distinguished delegates, I am pleased to join you at this important gathering of global health governance. This Assembly once again addressed a broad and critical agenda, from communicable and non-communicable diseases to health emergencies. Under the normative and technical leadership of the WHO, we believe important outcomes for global health will emerge from our deliberations. We are all aware that regional and global political concerns increasingly shape the international health agenda. Turkey approached international cooperation with the understanding that health is the foundation of all aspects of human life. In this spirit, we share the experience of our health system as a common global value and approach conflicts and wars primarily through the lens of human health. This also guides us toward all peoples deprived of their right to health, especially in Gaza. Distinguished participants, the theme of this assembly placed a shared responsibility upon all member states to strengthen constructive cooperation in reshaping the global health architecture. Turkey will continue to contribute constructively to global health governance, including international negotiations such as pandemic agreement. We remain fully committed to international cooperation with our new health model centered on research, development, and production. Distinguished delegates, with this opportunity, I would like to kindly invite you to the COP31 Health Day and the International Traditional and Complementary Medicine Congress to be hosted by Turkey this year. I thank you.
Cedo la palabra a Sri Lanka e invito a Kenia a subir a la tribuna.
Honorable Chair, Director General, Excellencies, distinguished delegates, Aibowan. This year holds special significance for Sri Lanka as we commemorate 100 years of our public health system, a century of community-centered public health services that has become a cornerstone of our nation's health achievements and social progress. Despite limited resources, my country has achieved remarkable health outcomes through strong public health leadership, preventive care, and community outreach. We have significantly reduced maternal and child mortality, eliminated malaria, controlled communicable diseases, and achieved high immunization coverage and low life expectancy. However, we now face new and complex challenges, including the rapid rise of NCDs, population aging, and increasing mental health needs. In response, Sri Lanka has embarked on an ambitious primary care reform agenda through our Arogya Health and Wellness Centers. These community-based, family doctor-led multidisciplinary teams focus not only on treating illness, but also on promoting health, preventing disease, identifying risks early, and providing continuous people-centered care close to where people live. 41 centers have already been established, with plans to expand 300 by the end of this year and 450 centers in next year. The reform prioritizes early detection of NCDs and common cancers while strengthening elderly care, rehabilitation, palliative care, home-based services, adolescent health, and primary mental health care. Guided by our national policy on health and well-being and the National Health Strategic Master Plan, Sri Lanka is building a modern, wellness-oriented primary health care model founded on a life course approach to health. Sri Lanka remains committed to working with all member states and partners to build resilient, inclusive, and people-centered health systems that leave no one behind. Thank you very much.
Cedo la palabra a Kenia e invito a Colombia a subir a la tribuna.
Thank you, Mr. President. Dear friends, at this very moment, the World Health Organization staff are saving lives on the front line of crises, responding to public health challenges like Ebola, and are often working in the world's most dangerous and demanding conditions. Whether in Ukraine, Sudan, Palestine, their work embodies what this organization stands for: science, solidarity, and service. It also serves as a powerful reminder of our shared responsibility to protect everyone and the essential civilian infrastructure that makes that care possible. I reiterate that the United Kingdom unequivocally condemns all attacks on civilian infrastructure. It is precisely because of these realities that the World Health Organization remains indispensable. At a time of profound and intersecting global challenges, its leadership, grounded in science, technical expertise, and evidence-based action, has never been more important. We saw the power of that global technical expertise and collaboration in the response to the hantavirus. The WHO's role in convening countries, setting global standards, and providing impartial advice is fundamental to strong health systems worldwide, and the UK is proud to support it. To meet the demands of today's crises and those ahead, the WHO must continue to uphold the highest standards of technical excellence. In that spirit, like others, we call for Taiwan to have meaningful access to all relevant technical WHO meetings and to observe the World Health Assembly as it did from 2009 to 2016. The United Kingdom is committed to translating science and innovation into real-world impact, including through our 66 WHO collaboration centres. We also commend Member States working to agree an effective, equitable pathogen access benefit sharing annex to the pandemic agreement. We must act now and urgency on antimicrobial resistance and also on the destructive power of nicotine, where the UK is taking bold steps to create our first smoke-free generation. Mr. President, the UK remains steadfast in our commitment to the WHO. Together we can strengthen an effective global health system that delivers for those who depend on it the most. Thank you.
Cedo la palabra a Kenia e invito a Colombia a subir a la tribuna.
Mr. President, Kenya aligns itself with the statement delivered by Mali on behalf of the member states of the African region, and we appreciate the Director General for his comprehensive report and for the pragmatic reforms proposed to strengthen this organization. In the light of the prevailing global health challenges, and in line with this year's theme, Reshaping Global Health, Kenya is undertaking a very comprehensive reforms to strengthen its health workforce, health delivery, and digital health structures. Colleagues, healthcare workers and health institutions must be protected from any ongoing conflicts. We continue to advocate for the access of health service and commodities to all citizens. In today's world, the question before us is no longer whether the global health requires reforms. It is whether we possess the collective resolve to build a global health order that is equitable, representative, resilient, and fit for contemporary realities. Kenya supports the redefined global health architecture anchored on 4 strategic imperatives. Equity must become the organizing principle of global health governance. Kenya is deeply concerned by the ongoing Ebola virus disease outbreak in DRC and Uganda, and calls for urgent need for equitable and coordinated global response. Outbreaks affecting African countries must receive the same level of urgency, solidarity, financing, research, and international support as emergencies occurring elsewhere in the world. Second, resilient regional manufacturing and supply systems must become very central pillars of preparedness. Africa is moving from dependency to sustainable production, technology transfer, and strategic investment. Multilateral institutions must evolve to reflect present global health realities. Legitimacy, fairness, inclusivity, and trust must be our guiding principle. The World Health Organization and Africa Center for Disease must therefore both remain indispensable to global health governance and must be adequately empowered. Just to finish, and very important, sustainable financing for health remains essential. Global financing frameworks must be responsible to and support domestic resource mobilization. Country ownership and long-term health system resilience is key to global health. Thank you very much.
Cedo la palabra a Colombia e invito a Mongolia a subir a la tribuna.
Señor presidente, Director General, distinguidos delegados, Colombia participa en este importante espacio global sobre la reconfiguración de la salud mundial con la convicción de que la salud es un derecho humano fundamental y un bien público global que no puede seguir subordinado a las lógicas del mercado. Nuestro país ha decidido pasar la página de las políticas neoliberales que redujeron la presencia estatal y profundizaron desigualdades para avanzar hacia un modelo preventivo, territorial y centrado en las personas, donde el Estado asume plenamente su responsabilidad en la garantía del derecho fundamental a la salud. Bajo esta premisa y el liderazgo del presidente Gustavo Petro, Colombia ha fortalecido de manera histórica su presencia en los territorios. Hoy contamos con más de 12.000 equipos básicos de salud, con 100.000 trabajadores que recorren el país, demostrando que la salud se construye desde las comunidades y no desde la intermediación financiera. Esta transformación, respaldada por inversiones superiores a $3,5 millones de dólares, evidencia que un Estado fuerte salva vidas y reduce desigualdades. Los resultados lo confirman. Colombia ha logrado reducir a la mitad la mortalidad infantil y disminuir cerca de un 20% la mortalidad materna. Además, hemos puesto en marcha un nuevo buque hospital que lleva servicios integrales a poblaciones ribereñas históricamente olvidadas, reafirmando que la geografía no puede ser una barrera para el derecho a la salud. La reconfiguración de la salud mundial exige también enfrentar las inequidades en el acceso equitativo a los medicamentos, garantizando precios justos, producción regional y transferencia tecnológica. Por tal razón, estamos promoviendo la creación de una agencia latinoamericana y del Caribe de medicamentos. Colombia reafirma su compromiso con una salud global más justa, basado en la cooperación, la soberanía sanitaria y la presencia activa del Estado. Muchas gracias.
Cedo la palabra a Mongolia. Invito a Georgia a subir a la tribuna.
Excellencies, distinguished delegates, on behalf of Georgia, I would like to congratulate the World Health Organization and thank the Director General for his leadership at a time when global solidarity and resilient health systems are more important than ever. Georgia remains firmly committed to the principle that health is not a privilege, but a fundamental human right. Over the past decade, we have continued to strengthen our health system through reforms aimed at improving access, quality, and financial protection for our population. Since the launch of the Universal Healthcare Program, more than 95% of the population has gained access to publicly financed health services. Access to essential health services has significantly expanded, while out-of-pocket expenditures have substantially decreased. In recent years, we introduced important pharmaceutical reforms, including reference pricing and managed entry agreements, with improving affordability of medicines and enabled us to remove annual ceilings on cancer and chronic disease medicines under the state programs. We are also advancing comprehensive primary health care reform to build a stronger, prevention-oriented and people-centered system. This includes new financial mechanisms, digital transformation, quality standards, and performance-based approaches to improve continuity and effectiveness of care. At the same time, we recognize that many challenges remain: demographic challenges, non-communicable diseases, mental health needs, climate-related risks, and growing financial pressures require stronger international cooperation and sustained investment in health system. Georgia remains committed to working closely with WHO and all partner countries to advance universal health coverage, equitable access to quality services, and healthier lives for all. Thank you very much.
Quiero recordarles que a las 13 horas pararemos las oratorias por otros compromisos y reanudaremos más tarde, en la tarde, la continuación. Ahora seguimos con, cedemos la palabra a Jordania y invitamos a Argelia a subir a la tribuna.
بسم الله الرحمن الرحيم. السيد الرئيس، يشرفني أن أقدم بيان المملكة الأردنية الهاشمية أمام هذه الجمعية الموقرة المنعقدة بعنوان إعادة تشكيل الصحة العالمية مسؤولية مشتركة، شعار لن يؤتي ثماره دون جهود حثيثة تسهم في تطبيق فوري في خضم ما يشهده العالم من أحداث تلقي بظلال كبيرة على الصحة العالمية بجوانبها كافة. لقد أثبتت التحديات التي شهدها العالم خلال السنوات الماضية من أوبئة ونزاعات وأزمات إنسانية وضغوط اقتصادية وتغيرات مناخية أن الصحة لم تعد قضية محلية تخص دولة بعينها، بل أكدت على المسؤولية الجماعية التي تربطها بالأمن والاستقرار والتنمية. ومن هذا المنطلق يؤمن الأردن بأن إعادة تشكيل منظومة الصحة تتطلب شراكة حقيقية قائمة على التضامن وتقاسم المسؤوليات والاستثمار المستدام في الأنظمة الصحية. وأشير هنا إلى أن الأردن استضاف الدورة الثامنة لمجلس وزراء الصحة لدول منظمة التعاون الإسلامي ومخرجاته أخيرا. ورغم التحديات الكبيرة التي تشهدها منطقتنا وما أنتجتها من تأثيرات كارثية، إلا أن الأردن واصل وبالنيابة عن المجتمع الدولي دوره في تعزيز المسؤولية المشتركة من خلال استضافة أعداد كبيرة من أشقائنا اللاجئين وتقديم الخدمات الصحية للفئات الأكبر والأكثر احتياجا انطلاقا من التزامه الإنساني والقيمي. كما يستمر الأردن في جهوده الوطنية لتعزيز الخدمات الصحية، وهي إنجازات شهدها المدير العام خلال زيارته للأردن شباط الماضي. وأؤكد على أن إعادة تشكيل الصحة العالمية لها أولويات مشتركة: تعزيز التمويل الصحي المستدام، ودعم القوى العاملة الصحية، وتوسيع التحول الرقمي وتعزيز الجاهزية للطوارئ، وضمان العدالة في الوصول إلى الخدمات الصحية، وعدم ترك أي فئة خلف الركب. نؤكد على أهمية الانتقال من الاستجابة المؤقتة للأزمات إلى بناء شراكات طويلة الأمد تعزز القدرات الوطنية وتدعم التخطيط الاستراتيجي والتعاون الدولي الفاعل. وأخيرا السيدات والسادة، إن مستقبل الصحة العالمية يعتمد على قدرتنا على العمل المشترك بروح المسؤولية والتضامن والثقة المبادلة. ولكم في الأردن شريك ملتزم بالتعاون مع الجميع لبناء مستقبل صحي أكثر أمنا وعدالة. وشكرا.
Cedo la palabra a Argelia y invito a Letonia a subir a la tribuna.
بسم الله الرحمن الرحيم، والصلاة والسلام على نبينا محمد. السيد الرئيس، السيد المدير العام، أصحاب السعادة، السيدات والسادة الوزراء والمندوبون، يسعدني أن ألقي هذه الكلمة بمناسبة هذه الدورة الموقرة في ظرف دولي يشهد تحديات صحية غير مسبوقة على غرار الجوائح والتوترات الجيوسياسية والطوارئ المناخية، فضلا عن التفاوت في الوصول إلى الرعاية الصحية. لقد سمحت السياسة المنتهجة في الجزائر بتحقيق تحسن ملحوظ في المؤشرات الصحية من خلال بلوغ متوسط العمر 80 سنة وتحقيق أهداف التنمية المستدامة المتعلقة بصحة الأم والطفل وضمان الاحتياجات الوطنية من الأدوية، فضلا عن القضاء على عدد من الأمراض المعدية. وستواصل الجزائر إصلاح منظوماتها الصحية عبر تعزيز البنية التحتية وتطوير الرقمنة وتكوين الموارد البشرية وتعزيز الطب الجواري، مع الإيلاء أهمية خاصة للوقاية والحفاظ على مجانية العلاج. وفي ذات السياق تجدد الجزائر تأكيدها أن الحق في الصحة حق أساسي غير قابل للتصرف، وتعرب عن بالغ انشغالها إزاء الوضع الصحي والإنساني المتدهور في دولة فلسطين والأراضي المحتلة جراء الاعتداءات المتواصلة التي مست المدنيين والمنشآت الصحية والطواقم الطبية، وتدعو الجزائر إلى ضمان الحماية العاجلة ووصول المساعدات الإنسانية والطبية دون العوائد. كما تؤكد الجزائر تمسكها بسياستها الإفريقية القائمة على التضامن والتنمية المشتركة من خلال تعاون صحي فعال يندرج ضمن رؤية للتعاون جنوب-جنوب، وذلك عبر الوكالة الجزائرية للتعاون الدولي من أجل التضامن والتنمية التي أقرها السيد الرئيس الجمهورية عبد المجيد تبون. إن هذه الجمعية مدعوة اليوم أكثر من أي وقت مضى إلى تعزيز العمل الجماعي وترسيخ الثقة المتبادلة بين الدول الأعضاء، لأن القرارات التي نتخذها اليوم تشكل مستقبل الأمن الصحي العالمي وتعزز قدراتنا على مواجهة الأزمات. وفي الختام أحيي التفاني للعاملين في قطاع الصحي في جميع أنحاء العالم الذين يشكلون الخط الأول للدفاع عن صحة البشرية. أشكركم على حسن الإصغاء والسلام عليكم.
Cedo la palabra a Chequia y invito a Malawi a subir a la tribuna.
Dear Director General, dear President, Latvia aligns with the statement of the European Union, and thank you for your report and presentation and for your leadership of this organization. Excellencies, dear colleagues, first and foremost, I reaffirm Latvia's full support for Ukraine's independence and territorial integrity within its internationally recognized borders. Latvia condemns all attacks on healthcare facilities and personnel and the grave humanitarian impact of Russia's ongoing strikes against Ukraine's infrastructure. I welcome and encourage WHO's effort in strengthening the health system in Ukraine under extremely dangerous circumstances. I also hope for and call upon termination of all attacks on healthcare workforce and hospitals in other conflict zones around the globe. Second, this organization and multilateralism itself is under attack, and there is a certain amount of doubt regarding the benefits of coordinating health issues at the global level. It's very important that we members of the science-based healthcare community remain highly committed to the core mandate of the organization and its leadership. I know that my country's region, the Euro region, has already made some painful but effective cutbacks. I sincerely appreciate Dr. Krug's leadership in this regard. Latvia itself operating under tight budget conditions, but I am proud to note we are doing our best to maintain a high level of healthcare protection for our citizens, for example, by actively implementing digital solutions and by executing a hospital coverage reform. Latvia remains fully committed to the finalization of the PAPS Annex of the pandemic agreement, and this recent outbreak of the hantavirus is just another example that proves we need to render the WHO leadership more tools and coordinate our common effort to ensure health security. Finally, Latvia would like to reiterate its repeated call for inclusiveness at this organization. Thank you.
Cedo la palabra a Chequia e invito a Malawi a subir a la tribuna.
Dear President, distinguished delegates, Czechia aligns itself with a statement delivered by Cyprus on behalf of the European Union and its member states. The focus of today's theme, Reshaping Global Health, a Shared Responsibility, reflects key insights gained in recent years. The issue of global health has transcended borders and benevolence, becoming fundamentally linked to collective security, solidarity, and trust. No nation can effectively confront pandemics, climate-related health threats, armed conflicts, or growing inequalities in isolation. These challenges underscore our need for robust multilateral cooperation, resilient health systems, and a renewed dedication to prevention and preparedness. The World Health Organization continues to serve as a vital convening platform and normative authority in this regard. In order to address contemporary challenges, it is imperative that all entities involved in global health architecture reinforce governance, transparency, and financial sustainability. Through modernization and adaptation to emerging risks, we can establish a more resilient and equitable global health framework. True shared responsibility must be demonstrated through coordinated actions and partnerships informed by local priorities. Ensuring that no one is left behind, we support the granting of observer status to Taiwan at the World Health Assembly, as global health threats do not know borders. Furthermore, we would like to appeal for strengthening the cooperation with all non-state actors. Regrettably, there remain actors who have not chosen the path of collaboration and partnership. The unprovoked, unjustified and illegal Russian war of aggression against Ukraine persists, as well as many other armed conflicts resulting in tragic loss of lives and continued attacks on civilian and healthcare infrastructure. Let us seize this opportunity at the Assembly to translate our commitments into measurable and meaningful progress. Thank you.
Cedo la palabra a Malawi y invito a Canadá a subir a la tribuna.
Thank you, the President, Excellencies, distinguished ladies and gentlemen. Malawi welcomes the Director General's opening address, particularly the strong emphasis on primary health care, and reaffirms that robust primary health care systems remain the cornerstone of universal health coverage, health security, and resilient, equitable, people-centered healthcare systems. Malawi's Health Sector Strategic Plan 3, under the theme Reforming for Universal Health Coverage, reflects our firm commitment to the primary healthcare operational framework, the Sustainable Development Goals, and the collective global pledge to leave no one behind. Malawi continues to increase investment in primary health care, with primary health care expenditure rising from 39.7% in 2019 to 42.7% in 2022. However, persistent challenges include health workforce shortages, financing gaps, donor dependence, and stockouts of essential medicines and vaccines underscore the urgent need for sustained investment, stronger coordination, and more resilient supply chains. In line with the theme of this Assembly, Reshaping the Future of Global Health, a shared responsibility, we firmly believe that this vision is both achievable and urgent, and that we all share a responsibility for safeguarding the health of present and future generations. In conclusion, we reaffirm our unwavering commitment to strengthening primary health care as a bedrock of universal health coverage, resilient health systems, and global health security. In an era marked by climate change, pandemics, and growing public health threats, investing in primary health care is not an option, it is essential. Thank you.
Cedo la palabra a Mongolia, por favor, y invito a China a subir al estrado, a tribuna.
Mr. President, it's a great honor to address the 79th World Health Assembly on behalf of the government of Mongolia. Mongolia warmly welcomes this year's theme, which powerfully reflects the importance of solidarity, multilateralism, and collective action in responding to today's increasingly interconnected global challenges. According to the WHO statistic, nearly 4.5 billion people are still lack to access to essential health service. These figures remind us that public health, environmental sustainability, and economic resilience are deeply interconnected and must be addressed through coordinated action plan. For Mongolia, those challenges are both immediate and tangible. Is a country increasingly affected by desertification, harsh climatic conditions, and air pollution, we recognize the importance of building resilience, inclusive and people-centered health systems. In this regard, Mongolia remains firmly committed to strengthening primary health care, expanding digital health and telemedicine services, and improving equitable access to health care, particularly for rural and vulnerable populations. Mongolia continues to advance evidence-based traditional medicine is an integral component of its national health system. In this regard, the President of Mongolia issued a decree in January 2026 on the development of traditional medicine, further complemented by the government adoption of the Action Plan for the Development of Mongolian Traditional Medicine for 2026 to 2030, aligned with the WHO Global Strategy on Traditional, Complementary and Integrated Medicine. Distinguished delegates, Mongolia remains firmly committed to working closely with WHO and member states and partners to build a healthier, safer, and more resilient future for present and future generations through solidarity, multilateral cooperation, and shared responsibility. I thank you, Mr. President.
Cedo la palabra a China. Invito a República de Moldova a subir a la tribuna.
尊敬的大会主席、女士们、先生们，中国认为，全球卫生治理体系改革必须坚持成员国主导，重视发展中国家的需求，促进全球均衡发展。一是提高健康在政治议程中的优先级，将健康融入所有政策，并置于优先位次，在理念、规划、投入、要素保障和健康绩效产出上进行多元谋划和推动。中国持续实施健康优先发展战略，不断提高居民健康水平，力求到2030年，健康中国建设取得决定性进展，并把中国人均预期寿命从现在的79岁提升到80岁。二是持续加大全球卫生投入，发达国家要落实承诺，履行义务。60多年以来，中国累计向发展中国家派遣了医疗队员3.1万人次，诊治患者3亿多人次。发明了治疗疟疾的青蒿素，为推动全球卫生公平可及做出了中国贡献。三是坚定支持多边主义，中方坚决支持世界卫生组织在全球卫生治理中发挥领导协调作用，与各方携手，推动全球卫生更为公平合理高效。中国愿与广大成员国携手努力，推动大流行协定附件谈判议程进展，共同构建人类卫生健康共同体。主席先生，世界上只有一个中国，台湾是中国不可分割的一部分。联大2758号决议和世卫大会25.1号决议早有定论。中方不同意台湾参加世界卫生大会，是中央政府的决定，得到了绝大多数成员国和世界卫生大会的有力支持。个别国家涉台发言违背国际法，中方敦促个别国家停止将卫生问题国际化和伤害正义人民的感情。谢谢。
Cedo la palabra a la República de Moldova e invito a Etiopía a subir a la tribuna.
Stimate domnule președinte, excelență, domnule director general, onorați delegați, trăim într-un context global complex, marcat de îmbătrânirea populației, creșterea prevalenței bolilor netransmisibile, riscurile climatice și crize suprapuse. Nici o țară nu poate aborda aceste provocări de una singură. Nici o țară nu își poate permite să acționeze fără dovezi. Republica Moldova reafirmă angajamentul ferm față de acoperirea universală cu servicii de sănătate, cu un accent deosebit asupra asistenței medicale primare. Promovăm servicii integrate, centrate pe persoană, inclusiv servicii comunitare și prevenire mai puternice. Punem accent pe sănătatea mentală, în special în rândul tinerilor, precum și îmbunătățirea accesurilor la medicamente esențiale și compensate. Realizăm acest obiectiv cu ajutorul soluțiilor de e-sănătate și inteligență artificială. Principalele reforme în sectorul de sănătate sunt conectate direct la procesul de aderare a Republicii Moldova la Uniunea Europeană. Considerăm că abordarea sănătate în toate politicile și conceptul o singură sănătate sunt esențiale pentru a răspunde provocărilor interconectate de astăzi. Subliniem importanța recomandărilor și ghidurilor OMS fundamentate pe dovezi științifice riguroase. Susținem rolul de lider a Organizației Mondiale Sănătății, precum și comunicarea și susținerea reformei organizației, inclusiv asigurarea unei finanțări sustenabile și previzibile. De asemenea, sprijinim procesul lansat de OMS privind reforma guvernanței globale în sănătate. Crizele recente, precum pandemia de COVID-19, criza energetică, impactul umanitar și economic semnificativ a războiurilor de agresiune a Rusiei împotriva Ucrainei ne-au oferit lecții importante. Trebuie să investim în sistemele eficiente de pregătire, supraveghere și răspuns, precum și cooperarea internațională pentru a fi în stare să răspundem la viitoarele urgențe. În acest sens, sprijinim punerea în aplicație a acordului privind pandemie, inclusiv anexa. Republica Moldova rămâne un partener de încredere a OMS. Vă mulțumesc pentru atenție.
Por favor, les recuerdo mantener el tiempo a los 2 minutos. Ahora cedo la palabra a Etiopía e invito a Eslovaquia a subir a la tribuna.
Ethiopia and invite Slovakia to come to the rostrum.
President of the Assembly, Director General, Excellency Ministers, distinguished delegates, it's an honor to address this Assembly, a defining moment as we stand only 4 years away from 2030, the deadline for SDG. Ethiopia comes before this Assembly with a clear message. Even in the most complex circumstances, progress is possible when leadership, community, and partnership converge. Guided by our Health Sector Development Investment Plan 2, we're accelerating the unfinished agenda of UHC, reaffirming our commitment to leave no woman, no child, and no community behind. The newly released finding of 2024-2025 Ethiopian Demographic Health Survey affirms meaningful, hard-won gains in maternal and child health survival. In just 2 decades, Ethiopia has reduced maternal mortality from 673 to 141 per 100,000 live births, a testament to sustained commitment, statewide reform, impact of investing in primary health care. Thus, results which we will continue to consolidate are a tribute to our health workers, our health extension workers, our midwives, our community leaders, and the resilient Ethiopian families. Primary health care remains to be Ethiopia's most powerful and most equitable platform for health for all, and we're strengthening our investment in primary health care by re-envisioning primary health care and ensuring health workforce reach grassroots communities, expanding digital health, strengthening community-based health insurance, innovating health financing, and transforming wearadas into engines of health coverage. Climate change is not a distant threat. It is persistent and intensifying determinant of health, and Ethiopia continues to lead this through Green Legacy Initiative, climate-resilient low-carbon health facilities, renewable energy deployment, and we look forward to hosting COP32 and to keeping climate and health firmly into global agenda across nutrition, non-communicable disease, mental health, AMR, emergency preparedness, and sustainable development through WHO 77, COP and beyond. As the world is shaping the new global health architecture, Ethiopia reaffirms its commitment to working in collaboration with WHO, African Union, regional bodies, global partners, guided by country ownership and leadership. Let us make this assembly a turning point, not defined by magnitude of challenge we face, but the depth of solidarity, the ambition, and the action. And I thank you all.
Cedo la palabra a Eslovaquia e invito a Uruguay a subir a la tribuna. Recuerdo, por favor, mantener el tiempo.
Distinguished Director General, Mr. President, Excellencies, ladies and gentlemen, Slovakia aligns itself with the statement delivered by Cyprus on behalf of the EU and its member states. An increasingly complex global environment marked by growing health challenges and mounting pressures on public budgets and donor financing, Slovakia highly values the effort of the WHO in strengthening the organization's stability and advancing a more sustainable future. The Slovak Republic believes that the reshaping global health requires resilient and person-centered approaches, firmly grounded in strong community engagement, partnership, and shared responsibility. Slovakia places strong emphasis on community-based models of disease prevention and health promotion, implemented close to citizens and in cooperation with local and regional authorities. We are convinced that the robust prevention systems are essential not only for improving health outcomes, but also for strengthening societal resilience, reducing inequalities, and ensuring the long-term sustainability and efficiency of healthcare systems. Slovakia highlights the ongoing Swiss-Slovak health program, which focuses on practical, community-based solutions addressing the root causes of non-communicable diseases and reducing health inequalities through cooperation with local authorities. In the global context, characterized by demographic transitions, environmental challenges, and persistent socio-economic inequalities, the Slovak Republic regards coordinated international engagement as indispensable. Such cooperation contributes to the strengthening of public health systems, enhances their resilience and responsiveness, and supports the development and implementation of policies that address the underlying determinants of health inequalities, while simultaneously improving the quality of life of all citizens. The Slovak Republic remains committed to international cooperation, solidarity, and shared responsibility in building healthier and more resilient societies. I thank you very much for your attention.
Cedo la palabra a Uruguay e invito a Panamá a subir a la tribuna.
Señor presidente, es un honor dirigirme a los Estados miembros. Quiero destacar especialmente el compromiso histórico de Uruguay con el sistema multilateral de la Organización Mundial de la Salud como red global de gobernanza sanitaria internacional. En este sentido, nos sumamos a la discusión sobre la reforma de la arquitectura mundial de la salud impulsada por la Organización de Naciones Unidas y la OMS, que pone a las personas en el centro. Tenemos la convicción de que optimizar recursos es mejorar el acceso con equidad, asegurando la sostenibilidad de los países. Los países como Uruguay, con sistemas de salud que tienden a alcanzar la cobertura universal, enfrentamos el desafío de gestionar tecnologías sanitarias cada vez más costosas que pueden poner en jaque la sostenibilidad de los sistemas. A casi 20 años de la creación del Sistema Nacional Integrado de Salud en el Uruguay, el financiamiento público es la principal fuente de financiamiento del gasto total en salud. Hemos mantenido el nivel más alto en el año 2024, situándose en el 6,72 del Producto Bruto Interno, con un gasto total que representa el 9,31% del PBI. Se ha mantenido un descenso sostenido en la mortalidad mortalidad infantil, demostrando que es posible construir sistemas de salud universales y sostenibles. Sin embargo, estos números en nuestro país y en el mundo esconden una clara desigualdad territorial. Garantizar respuestas integrales para niños, niñas y adolescentes en situación de extrema vulnerabilidad constituye hoy para nuestro país una prioridad nacional y política de Estado. Compartimos el llamado a abordar los problemas de salud mental, consumo de sustancias y adicciones con estrategias integrales, y Uruguay también convoca a abordar todos los factores de riesgo de las enfermedades no transmisibles que hemos sido pioneros en el mundo en la lucha contra el tabaquismo. En nuestro país defendemos el derecho fundamental de las mujeres a tomar decisiones informadas sobre su salud sexual y reproductiva, condición clave para la equidad, y convocamos que así ocurra en todos los países del mundo. Estimados representantes, sepan que en Uruguay siempre tendrán un aliado para promover que todos los países tengan sistemas de salud sostenibles centrados en las personas. Muchas gracias.
Cedo la palabra a Panamá e invito a Pakistán a subir a la tribuna. Fernando.
Gracias, señor presidente. Excelencias, ministros y delegados, Panamá agradece la presentación del informe y expresa su respaldo al proceso conjunto orientado a fortalecer la reforma de la arquitectura mundial de la salud en el marco de la iniciativa ONU 80. La experiencia reciente nos dejó una lección clara. Ningún país puede enfrentar solo las amenazas sanitarias del siglo XXI. Las pandemias, los conflictos, el cambio climático, la resistencia antimicrobiana y las crecientes desigualdades han demostrado que nuestras vulnerabilidades son compartidas y que nuestras respuestas también deben ser. Hoy enfrentamos la necesidad urgente de una arquitectura mundial de la salud más coherente, mejor coordinada y más eficaz. La fragmentación institucional, la duplicación de esfuerzos y las inequidades persistentes continúan limitando nuestra capacidad de respuesta colectiva. Panamá considera que este proceso representa una oportunidad estratégica para fortalecer un sistema global más ágil, más inclusivo y más centrado en las necesidades reales de los países, reafirmando el liderazgo técnico y normativo de la OMS como eje articulador de la cooperación sanitaria internacional. En el ámbito nacional, Panamá impulsa el fortalecimiento de la atención primaria de salud, la ampliación de la cobertura sanitaria, la transformación digital del sistema y el acceso equitativo a medicamentos y vacunas. Asimismo, avanzamos en una hoja de ruta de la integración de los servicios de salud orientada a mejorar la eficacia, calidad y continuidad de la atención. También promovemos el enfoque de una sola salud, reconociendo la interdependencia entre la salud humana, animal y ambiental como elemento esencial para prevenir futuras amenazas sanitarias. Que en ese compromiso, Panamá tendrá el honor de ser sede en la próxima conferencia de las partes de los convenios de Basilea, Rotterdam y Estocolmo 27, reafirmando nuestra convicción de que proteger la salud humana también exige proteger nuestro entorno. Señor presidente, reformar la estructura mundial de la salud no debe limitarse a rediseñar estructuras, debe permitirnos construir un sistema internacional más preparado, más equitativo y más capaz de responder a los desafíos comunes de nuestro tiempo. Muchas gracias.
Cedo la palabra a Pakistán. Invito a Guatemala a subir a la tribuna.
Bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Assalatu wassalamu alayka ya khataman nabiyyin. Thank you, Chair. Global health stands at a defining crossroads. Our interconnected reality as a global village demands collective action and shared responsibility. Pakistan, a nation of over 260 million people with more than 6.19 million newborn annually, faces significant healthcare challenges. Yet we have achieved measurable progress. We have reduced maternal and child mortality, expanded immunization coverage, and strengthened responses to TB, HIV, malaria, dengue, and hepatitis. Our universal health coverage index has risen from 40 to 56% since 2015. Polio eradication remains our foremost national priority. With sustained efforts and continued support from the Global Polio Eradication Initiative, we are confident of a polio-free Pakistan. Our government has launched a 10-year health and population strategy anchored in a shift from sick care to health care, building resilient primary health system that protects, empower, and uplift every human being, regardless of geography or circumstances. Pakistan has approved its first ever national vaccine policy and is advancing indigenous vaccine production through national and international partnership. We are proud that our 188 medical colleges produce over 22,000 skilled doctors annually, serving Pakistan and the world. We call on the global community for meaningful co-investment in the human capital which belongs to us all. At the global level, on the WHO pandemic agreement, Pakistan will engage constructively to finalize the PAPS Annex on the basis of equity, equal footing, and clear legally binding commitments. Finally, calls for efficiency in the global health architecture must never come at the cost of WHO's countries' presence or support for developing nations. I thank you, Chair.
Cedo la palabra a Guatemala.
I give the floor to Guatemala.
Señor presidente, director general, delegados. A 6 años de la pandemia de COVID, el país continúa fortaleciendo la coordinación nacional, regional y mundial. Bajo un enfoque de una salud, Guatemala trabaja en la coordinación interinstitucional del Estado en materia de vigilancia epidemiológica y la respuesta oportuna ante amenazas sanitarias. La coordinación regional se refuerza a través de la aprobación de la estrategia Una Salud 2026-2030 del Sistema de Integración Centroamericana para promover respuestas integrales a los desafíos sanitarios. Los sistemas de salud también enfrentan retos considerables por la creciente carga de enfermedades crónicas no transmisibles. Estas enfermedades saturan el sistema de salud y son una carga financiera insostenible para cualquier país. Para avanzar hacia una sostenibilidad verdadera, es indispensable abordar los determinantes sociales y comerciales de la salud, promoviendo entornos físicos, sociales y políticos más saludables. Esto implica fortalecer las políticas y estrategias orientadas a reducir el impacto de las prácticas comerciales que incentivan el consumo de tabaco, alcohol y alimentos ultraprocesados, los principales factores de riesgo de estas enfermedades. Solo a través de esta transformación estructural será posible facilitar ambientes saludables y abordar las causas de la enfermedad desde la verdadera promoción de la salud. Nada de esto es posible sin desarrollo comunitario. Por ello, a través de la Alianza por la Atención Primaria en Salud en las Américas, Guatemala fortalece las capacidades locales y consolida una red de atención resiliente, promoviendo así que la salud sea accesible para todos. Adicionalmente, Guatemala agradece el apoyo de países amigos a través de los lazos estrechos de cooperación a favor de la salud de los guatemaltecos. En esta ocasión, resaltamos las acciones realizadas por la República de China, Taiwán, cuyos proyectos mejoran la prestación de servicios de salud en Guatemala. Muchas gracias.
Como establecimos a las 13, y ya son las 13:05, y vamos a cerrar la lista de oradores porque tenemos otras cosas que hacer importantes. Voy a dar algunos puntos antes de levantar la sesión. La Comisión de Credenciales celebrará su primera sesión hoy a las 14 horas. Los miembros de la Comisión se dirigirán a la sala 12. La próxima sesión plenaria se celebrará en esta misma sala por la tarde una vez concluida la sesión de la Comisión de Credenciales. Quisiera recordar a los delegados que la mesa redonda estratégica titulada "De las lecciones extraídas de la COVID-19 a la acción, la evolución del programa de emergencias sanitarias de la OMS tendrá lugar hoy de 13 a 14:15 horas en la sala del Consejo Ejecutivo de la sede de la OMS. También quiero decirles que antes de dar por concluida la sesión, llamar la atención sobre el sistema de micrófonos y tarjetas de plástico insertadas en él que permiten identificar correctamente a su delegación cuando solicitan tomar la palabra. Les ruego que se abstengan de retirar las tarjetas del sistema para que puedan participar en los debates sin interrupciones. Muchas gracias por su colaboración a este respecto. Se levanta la sesión.